We set up a solution exchange where bilaterally and multilaterally partners could exchange support to each other. Thirdly, there were some fairly big problems COVID threw at all of us. Oxygen shortage, plastics which were generated because of COVID. And we took the opportunity to solve those problems, not just in an ordinary way, but to create triple impact and see it as an opportunity to solve it forever. So we did this with three types of partners. One is the implementing partners, which include civil society on the ground, government, and other partners. Secondly, providers, which included policy, financial provision in terms of donors and other kind of providers. And thirdly, enablers, which include consulting organizations, design companies, material suppliers, and a whole range of other partners who can enable action on the ground. So these three partners were brought together, and essentially what we were looking for is really three outcomes. One is resilient and thriving vulnerable communities and organizations which are working with them becoming efficient and effective during the period. And in the medium to long term, our hope was to build a dynamic humanitarian response ecosystem, which will not only be looking at COVID, but beyond COVID too. And there are two major things we were looking at here, which is completely leveraging the assets of the 350 partners on the ground, as well as amplifying what our partners were doing on the ground. Next slide, please. So as I go along, I will be talking to you about the calibrated services first, and then to the solution exchange, and later on to the impact canvas. So the multidisciplinary partnerships now is across 35 states, and we're working with 23 government entities and 30 private sector partnerships in doing a range of things, including vaccination, social protection, surveillance, helpline, providing care and support, generating demand for vaccination, NCD screening, and a whole range of services which are reaching a large number of communities. Next slide, please. So who are the people that we are talking about? And these are the communities that are very, very critical to the COVID Action Collaborative, which should put them at the center, right? Transgender communities, street children, people living with disabilities, street vendors, people who are generally not, reached and who have access difficulties to healthcare anyway. And during pandemic, this was accentuated quite a bit. And therefore, they were our main customers and consumers of the services. So we have delivered around 14 million service instances to these people. And we did 1 million before the start of the USAID partnership. And thanks to USAID and SCOL partnership, we've been able to reach the 13 million additional communities that we have done so today. And we have done it in agility and speed, which I will talk about a little later. Next, please. So in terms of the services itself, we found that there were two major routes for us. There are partners, some of whom were very clear what calibrated services that they wanted to provide. For example, the fishermen community were very clear what they wanted to do with their communities. And our role was in really supporting these partners. The second is at a CAC level, we continue to create for every wave a high impact intervention, which was very relevant to that specific time period, which included a package of health, livelihood, and social protection delivered together. And this we made available to our partners. And in fact, across, we made it completely freely available to everybody. Through this process, we have generated almost around 308 knowledge products, which includes checklists, playbooks, and a variety of tools, which are all freely available on the website, not just for our partners, but openly to the entire community. And when we keep talking about these numbers, I want you to keep one thing in mind. We are not here as COVID Action Collab to just add and summate what all partners have done and report it as our own. No, what our partners have done probably are 50 million services and more. I can't even tell you how big it was because we don't ask for that information. What we do ask for information is what is the support we have provided to partners, and based on that, what has been the reach. So the 14 million is an additionality that we've added to the partners to what they have already been doing. And these are the types of services that have been delivered through the partners. Next slide, please. So in terms of connections, which I mentioned to you, a vibrant community of partners definitely need to exchange a set of services, right? And that in terms of capacity building, financial, materials, technology, and other kinds of connects is what we have managed to do. Literally, there has been 1,000 requests, gives and takes from our partners. In fact, we are at 998 at this moment, out of which we are happy to say that 71% of those have ended in some some kind of a good outcome for the partners, whether they were giving it or taking it, right? And therefore, we don't double count both. There are 71% of those asks which have been met by the COVID Action Collaborative, other partners, or the Secretariat has managed to reach it. And two examples which are given here is Association for People Living with Disability, APD, has been able to reach 20% more people with the support of CAC. And RCPD is one of our partners, has been able to ensure vaccination, double vaccination for over 85% of the people that they work with. Now, this is not to say that we have met everything. We still are struggling to ensure that all our partners get the services that they require. And we do continue to disappoint some of our small set of partners who we have not been able to support in any way. And our endeavor is to ensure that we are able to do so with every one of them. Next. So how has this been enabled through resources? Financial resources are very, very critical, both in kind and cash. And to do that, COVID Action Collaborative has a very small but a very strong resource mobilization team, which has managed to raise around 245 crores in the last 2 years, of which 87% of the funding has gone to the ground level partners. And the money has gone to, money and cash and kind, both have gone to around 180 partners on the ground, 79% of them who are implementing partners. And we are very proud about this. And the resource mobilization team has contacted hundreds of donors, both in India and abroad, and managed to engage strongly 89 donors in this process who have invested in the COVID Action Collaborative, in addition to the investment USAID and CMS made in the Secretariat itself. Plus, we didn't stop with just raising money. We were very keen that money does not need to come to COVID Action Collaborative. The right kind of issues and communities and the partners need to get the money. So we have managed to shape, which means we have helped conceptualize, we help connect and facilitate resources right up to around 80 crores for partners. And another big win has been leveraging resources. This has come from both government and private sector. We have managed to get 755 crores leveraged, and large part of it, almost 700 crores, is financial assistance from the government meant for vulnerable communities. And we have managed to unlock through CAC and its partners to reach these resources to the people who require it the most. So in total, we are proud to share that almost 1,000 crores has been mobilized for all the partners' work. And this has been done through multiple investment options being provided, multiple themes, geographies, communities, and partners. And we continue to tweak it across the various kinds of challenges that we faced in the waves. And we have been successful, and you see some of the logos here of the partners who have been involved. And for core investors like USAID and CMS, we have managed to leverage 11 to 49 times of the investment that they made on the COVID Action Collaborative. Next slide, please. So the third area is really constructing solutions for some of the tough problems COVID has presented to us. And we have identified 12 impact canvases, which are outcome focused, and is also trying to solve a problem and come up with a scalable solution. And right now, all of these impact canvases are to be expected at various stages. Some of them are at concept level. One example is living equipments. You saw the scramble for oxygen equipments, related equipments, and how many of them are lying, without use in various districts. To avoid this and the future pandemics, as well as to manage equipments at a district level better, we have come up with the concept called the living equipment, which is IoT-enabled management system, social enterprise-driven, which is local maintenance of these equipments, and a clear dashboard telling the district authorities and others where is what equipment and whether it's working or not. And this concept is about to be piloted. So we have pandemic plastic, which I mentioned to you, which is on piloting stage. And we have several other things which are scaling. Surveillance, for example, early warning surveillance using sewage water, which started off in Bangalore, is moving to 30 to 50 cities. And there are certain other solutions like VaxNow, which have gone fairly big in terms of scale, and we're very happy about that. And again, not everything has been successful. 50%, almost 10 initiatives have been hibernated because they have lost their relevance, or we don't have partners who are willing to put their time and effort to move it forward, or it has simply failed. So we have to accept it and move on. So this has been a mixed bag, but overall, I would say 50% of all initiatives are showing extremely good promise to solve the problems we set out to do. Next slide, please. How has all of this been managed? So we have a secretariat of 100 plus people, and we have almost 30 people who are focused on partnership results acceleration, PRAs as we call them. And we have a governing council of luminaries whose names you will see shortly, who've been continuously advising, facilitating, sharing learnings, and also help us see the risks we were not able to see. And they have met almost 50 times in the last 2 years without fail and provided this guidance continuously to us. We also have Impact Canvas advisors. For each of the Impact Canvases, we have an advisory forum. We set up a caring CEO forum for the private sector. It is at a very initial stage. It has not reached its full potential, and we need to work on improving it. We also have an investment committee, which we call INCOM, which provides continuous guidance in terms of where do we put the resources raised, who should get the money, which partner will get it and not get it. And in addition, internally, we have a research and evaluation wing, which has been capturing the numbers, counting them, validating them, process tracing them to assess both contributions and signs of change, and also sharing these learnings to the wider audience. Next slide, please. To summarize, I would say there are 3 lessons we would like to share with you in our journey, which has obviously seen ups and downs. One is you have to architect collective impact, and architecting requires you to put people at the center, multidisciplinary teams to think through some of the big challenges, but at the same time, high impact teams on the ground level implementing them. And you also need to support what partners are doing, as well as provide options of packages to partners with resources so that they can take it forward. And the collective impact is not just on paper, but on the ground. Secondly, you have to orchestrate resources and initiatives. Raising significant resources is not an option. You need to do it for a collaborative. And that's very important to also channel it to the right places and the right issues and communities. And creating a dynamic engagement platform of gives and takes, what I was mentioning to you. Although our technology platform failed us, the non-technology part of it did take off. You did see 1,000 such exchanges which have happened between the partners. And that's very, very critical to show how dynamic the network is. Thirdly, and most importantly, you have to actively explore why we are not able to collaborate. For example, we have not been able to collaborate extremely well with all partners, and therefore all partners have also had some difficulties. So we have been looking at those issues, continuously solving them. Thirdly, we have to act with urgency and agility. This is a pandemic. People are dying and people require services now. And therefore, there is a huge bias to action, and that to grounded action and decentralized action. VUCA scenario means we have to constantly adapt and be agile. And we also have to measure the right things and celebrate what, like we are doing today, celebrate the right things, but also learn and acknowledge what is not working as we move along. Next slide, please. So I want to end it in a little bit of a different note. I want to provide a sincere apology to all partners who we have not been able to meet your expectations or partly only meet your expectations. But I also want to thank all of you who worked very closely with us on behalf of the Governing Council, whose photographs you see here, because they have played such a significant role. And I would like to pass on the congratulations to all the communities who have worked closely with us, the organizations who worked with us, the donors who provided the resources, and all the advisors who worked very closely. If I didn't call out or you don't hear your name throughout this celebration, that doesn't mean that you're not important. It just means that there is so much happening that we may miss out. And thank you very much for listening to me. And thanks to my team for giving me this opportunity.
Thank you, Shiv. Thank you, Shiv, for sharing CSC's wonderful journey. It has been my pleasure being part of the collaborative.
It is now my privilege to introduce Ms. Sangeetha Patel, Health Office Director, USAID India. USAID India is a strong supporter of the COVID Action Collab. The Collab would not be here today if it was not for the unstinting support of the entire team at the Health Office, ably led by Ms. Sangeetha. Sangeetha, it was your passion to address vulnerable communities that united 3 sectors: private, public, and civil society. You invested in us and accelerated our efforts. Your leadership has been instrumental in our success. Sangeetha, over to you.
Thank you so much, and just really excited to be here today with you. A huge and happy welcome and celebration today. It's just an honor for me to be a part of this exciting and important event, really collectively taking a breath and honoring the 10 million people who've been reached with critical COVID information, testing, vaccination, care, and support services. I think all of us at USAID are extremely heartened by the fact that, we've had an important part in this journey, and that Shiv allowed us to really be a part of this celebration. I know that from our perspectives, everyone in USAID commends you really for taking the time and effort to make sure that vaccinations and even the critical economic and support services are actually ensured for the hardest to reach populations. For me, I really go on record as well to really appreciate the support and partnership with Niti Aayog, with the Ministry of Health and Family Welfare, local governments and associations, as well as the private sector. It's when all of these hands came together, especially during one of the worst humanitarian crises, that we really saw the true worth and the true meaning of partnership. For me, at least, I know that during the initial stages of COVID and even throughout subsequent surges, it was just incredibly devastating to see a series of lockdowns and families and really communities completely impacted. And I think, Shiv, you and your team through the COVID Action Collaborative incredibly responded at the heart of this emergency. And since then and now growing to over 200 diverse partners, you literally cultivated the trust and the reach that was needed to be able to go into the hearts of the most vulnerable communities and truly say, I care, and I'm here for you, and I'm going to do anything that I can to make a difference. In these last 6 months, I've actually had the personal opportunity to visit sites, not only in Gujarat, but also in Bangalore. Whether it was, a remote fisher village, or whether it was talking to sex workers, transgenders, and even the urban poor in Bangalore, I think that for me, it was just heartening to hear the voices of not only the local organizations, but also community and religious leaders. It really allowed me to understand that some of the volunteers commute hundreds of kilometers to reach people with information and services. And they literally are the ones that lend the confidence and support that's needed, especially at the community level, to make a difference. Whether it was madrasas, whether it was, planning and coordination at community level, or even ownership by an individual. What I saw touched my heart, and it made me realize that we really were making a difference and continue to do that. These last 15 months have seen us witness, second and third waves, and it's also required us to innovate, to think in terms of technology, as well as even non-traditional partners, ultimately to be able to make a difference. And as you heard from Shiv, whether it was wastewater surveillance or whether it was hospital networks in second and third tier cities, this really was our opportunity together collectively to really extend, health and social protection alongside the government of India. I think that's why today reaching 10 million is incredible, and I'm here to celebrate. But I also reiterate the point that the work isn't over. USAID certainly has been working for, several decades, the past 70 years with the government of India in partnership. And certainly most recently through COVID with an additional $225 million dedicated for a range of activities, not only this COVID Action Collaborative, but also, of course, when it was needed the most, the critical oxygen generation, the COVID war rooms, the data for decision making, the vaccinations, and really ultimately the strengthening at the community level and genomic sequencing that was needed really because of the mutations of the virus. I think that really though, I'm humbled to say that it's with this partnership that we also reached out to the private sector. And we were able to mobilize from $30 million to 10 times that ultimately, and actually be able to support over 25 innovations, including now moving forward, those that particularly support women entrepreneurs. So for me, at least, what I found in this crisis is that we were able to support not only a sense of commitment and community and work together extensively, but really collaborate to look at resiliency for the future and to really consider what we can do systematically together. I'm heartened especially by Shiv's announcements of even seeing that from these initial ventures and experiments that we're able to continue to go to scale and continue to expand. It's with these deepest wishes that I really congratulate the COVID Action Collaborative, and I really encourage, the team at CMS CAC to continue to document and to really share these incredible feats, but also to continue to leverage, and be able to do even more. I think that it's really with this stellar dedication and support that we've not only be able to meet our objectives, but also really to work hand in glove with the government of India and really show that together in partnership we can make a difference. I know that the government of India has done an incredible job with vaccination, especially given the magnitude of the population here in India. They've worked through COVID and certainly have been able to figure out with no boundaries how to be able to really expand that reach, and I hope even share those lessons regionally and globally. So I think it's with that in mind, and even through learning exchanges, whether it's the, Covalex or even the work of Vax Now and CMS CAC and the COVID Action Collaborative, that we're doing what we set out to, that ultimately we said we wanted to reach the most vulnerable, and that is what we're doing. I think if I were to really end with just one wish and one congratulatory note, it would be to really thank Shiv for his dedication, and especially his entire team of the Catalyst Management Services and the COVID Action Collaborative. You've made a difference in so many lives, and USAID is extremely proud in being able to support you in this journey together, but also looking forward to the future, because the battle isn't over. And for us, what we realize is that it's with this collaboration and really partnership that we're going to be able to face the future, and really in whatever next iteration, ultimately be able to work at the community level and at the heart of where we can actually listen to concerns and be able to make a difference. So thank you so much, and just an honor to be with you today as we reach and pass that 10 million.
Thanks to you, Sangeetha, and the entire USAID team for your unwavering encouragement that help our communities when they needed it the most. We will certainly take your advice, Sangeetha, and focus on, sorry about that. We'll certainly take your advice and focus on documenting and disseminating our learnings the world over. You saw the potential of CAC and trusted us so we can get to where we are today. And it's our privilege to have USAID be part of this journey.
Today, we are extremely honored to have Dr. Manohar Agnani with us. Dr. Manohar Agnani is the Joint Secretary, Policy and National Health Mission, Ministry of Health and Family Welfare, Government of India. A 1993 cadre IAS officer, Dr. Agnani is also a medical doctor and public health specialist with many significant achievements in strengthening health systems in our country. Sir, you may have recalled, you had flagged off the COVID Action Collab and USAID India partnership 2 years ago. It's our privilege to have you back today after the soft launch. Sir, we invite you to say a few words on this occasion.
Thank you, Shankar. I hope I am audible. So,
Yes, sir.
good morning to all of you. Yes, I remember 2 years back when we started as a collaboration to work for the COVID action, and Meghna just introduced us that how this humanitarian response was taken systematically by all the partners. Today, I don't want to use the word partners. I just want to use we all together as a society responded to this extreme difficult time we all had. It's also time to be emotional because the way the human beings have responded to these 2 years to COVID, not only in India, but across the globe, I would say it has been very required response where we learned a lot of things. And when Shiv Kumar was making his presentation, I would say he was very humble in showing what the achievements were. Everybody, all of us have gone through this phase personally. I am also not an exception. I remember how in ministry, we tried to respond to everyday challenges. It was like building the ship while sailing, making errors in calculations, making errors in plannings, making errors in implementation. So would be the case for all of us. And when Shiv Kumarji was saying that there were some initiatives which they could not take to the conclusion, that's how we have to be honest about our work. In a sense, everybody would agree that this COVID experience is a total experience. Total experience in the sense that how should we work in an integrated manner on issues around health, food, livelihood, social protection, and so on. I remember I was made in charge of the COVID vaccination. If I may take some time to say, people had a lot of questions to ask. Can we do it? Do we have systems in this? Can we have the storage systems? Can we have these number of vaccines available to us? Do we have a IT solution to this? And there were a lot of doubts, not only in the minds of those who are outside government, but within the government, I must say. And we were also not very sure. But today we see that with the effort of all of us, we have reached to a significant milestone where we have some satisfaction of working together. This is an excellent example of collaboration. And we initially had issues around vaccine hesitancy. How will we address this? Is it okay to vaccinate pregnant and those who are lactating? Will it be okay to go to the old age population in their homes, going closer to the community? How we will manage the adverse events following immunization, and so on. But it has been a tremendous collaboration. And I was with some of the vaccinators on International Women's Day. Some of you were also participated in that program. The type of responses when you talk to them, how they ignored their family needs, how they took everything side apart just to be with the mission of saving lives. So this was not only COVID vaccination, but actually the surveillance part, going to the community, savings, and somebody made a reference to the crisis of the systems requirements also was something which was we all are aware of how we responded to it, but not as a government officer. If you ask me on my personal level, I would say that there has been a tremendous satisfaction. It's up to us how we see, how we responded to this. I, by nature, I am an optimist, and I'm very much satisfied the way we all have responded to this. Shikumaji was saying that 1,080 crores worth rupees were raised through collaborative action, and out of those, around 245 crores were actually raised. So 1,080 crores were made available. 89 donor partners, and 87% of it went to the ground level partners. So this is not a small thing. This is actually an experience that how in future responses we should allocate to the scarce resource we have. Working with the grassroots organizations is actually the value for money. And when he was referring to the outcomes, he said that 71% of it was delivered, and a case in reference was made of the Association of People with Disability. So I remember when this COVID-19 started showing its impact in our society. Having a background in public health, I always used to think that should it not be our response to protect our elders first? And that was the classical response of managing any epidemic, that those who are the most vulnerable should be protected. We all have made our efforts, some successes, some failures, of course. We had some unfortunate deaths also in this entire journey. So I just want to remember all of them, and I really want to say that even then there is a tremendous satisfaction in what we have been able to do. And when it comes to the actually saluting the work which these ground level partners through this COVID action collaboration has done, I must thank you from the core of my heart, the tremendous work which has been done. Now coming to what next, I think one thing which I wanted to advocate for many years in my life, and I failed, but this one COVID thing did it nicely, was building the systems. I'm a strong votary of building the public health systems largely, and health being a public good, I still feel unless we have those strong systems, surveillance systems, the infrastructure, the human resources, the capacities, the skills within the government system, we can't respond to these challenges. And the way we all have responded to building the infrastructure, in augmenting the infrastructure of hospital beds, coming out with the dedicated COVID centers. And I'm a medical graduate, but I was never taught oxygen to the extent which this COVID management has taught us. We moved from oxygen storage and supply to storage generation and supply. The nitty-gritties of storing in liquid medical oxygen centers, building the transport systems, and also then PSA plants. That's something which I was part of this journey. Many of you have supported in that, and we all have worked together so that initially we were reluctant to actually think of providing the us to these through the systems. But the way we have responded is actually, Mr. Shivkumar was saying, what next? So I would say that we have learned that we need to build the health systems. Probably we need to do some more work. Our surveillance systems need to be further strengthened. Can we have a mechanism where we identify such threats in time? I personally feel that that's something which we need to weather. That's two. Third is, of course, on working with the communities and national health through national network of national health mission. We have been propagating these concepts way back from I would say 2005, but the need for working with the grassroots level workers and the partners is further strengthened. And of course, I would definitely say that we have also learned to use our limited resources to the best possible way, and we need to work on that together. I really want to thank you all for becoming part of this journey. And if after some years, when I take my retirement from this public life, would definitely like to document the experience we all have gone through. And for me, these 2 years have been very satisfying. There were a lot of challenges on the personal and in personal level and the official level, but we all have come through. I know you have much better stories you have gone through with the similar pains, and you also have worked very hard. But at the end, being optimist, I would say that let's be partner forever. Let's be partner forever. Let's give it to those who deserve. Let's try to build a society which is equal. Let us try to bring the differences to the minimal possible level. And then we can proudly say that, yes, we are human beings. Thank you for inviting me for this important, I would say, discussion on 2 years journey of working together. I am satisfied, and I hope you all would have satisfaction at your end. Thank you very much. Namaskar and Jai Hind.
Agnani, thank you so much for taking your time, sir, for coming and being with us today. I know how busy things are for you within the ministry. Really appreciate you taking the time and carefully going through what we have done. And, sir, your kind of leadership is what inspires us. And what I want to also acknowledge is not once have we been, whenever we ask for support in any of the states or at district level or at national level, we've always got the support of the government. And the 1,000 crores that you attributed to us, 755, almost 700 of that is from the government, meant for the schemes for the poor. And we are glad we've been able to play a role, sir. But thank you, and continue to guide us. And, as collaborators, we would be very happy to work more and more closely, because COVID is gone. But as you said, system strengthening, this is a great opportunity, and we'll work with you very closely, sir. Thank you very much.
So thank you so much for joining us today, in spite of your busy schedule. Your words have truly inspired us to continue collaborative efforts across society, continue being honest about our uncertainties and failures, and continue building systems to support vulnerable communities in the future. Let's be partners forever. We'd be delighted if you can stay on and listen on. We now have a documentary to provide a flavor of the community champions and 125 community-based organizations who have worked on relief, recovery, and resilience building activities over the last 2 years.
இப்போ நான் தனி அறையில் இருப்பதனால மாஸ்க்கை ரிமூவ் பண்ணுறேன். இந்த இரண்டாவது கோவிட் பாதிப்புகள் வந்து அதிகமாக ஏற்பட்டது வந்து கிராமப்புறத்தில் தான் அதிகமாக ஏற்பட்டிருக்கு.
যখন প্রথমে কোভিড-19 শুরু হলো সেই সময় তো আমি যেহেতু একটা রোগে আক্রান্ত আছি এইচআইভিতে।
पहलू करोना कहना मन को ओळखता नहीं होता कि हान केती करोना ते आखे हेली हुकवा उडीगी के करोना ने बीमारी आखे फरी रही हम कर साफ मन को कहता था
ಈ ಲಾಕ್ಡೌನ್ ಟೈಮಲ್ಲಿ ನಮ್ಮ ಹೆಣ್ಮಕ್ಳಿಗೆ செக்ஸ் ஒர்க்கே ஸ்டாப் ஆகிட்டு.
என்னைய மாதிரி சமையல் கலைஞர்கள் வந்து நிறையவே கஷ்டப்பட்டுட்டோம். நிறைய ஆர்டர் வந்து कैंसिल ஆயிருச்சு.
जब कोविड अपने चरम पर था और जब लॉकडाउन लगा हुआ था उस टाइम पे ऐसी भयावह स्थिति थी, सोशल मीडिया के माध्यम से कई तरह के అఫ్వాయే సోషల్ మీడియా మీద చలాయి జారీ थी.
మహిళలు లేకపోతే ఒంటరి మహిళలు లేదంటే వ్యవసాయ కూలీలు అలాగే ఎక్కడి నుంచో ఇక్కడికి బ్రతుకు తెరువు కోసం ఇతర ప్రాంతాల నుంచి మా ప్రాంతాలకు వచ్చినటువంటి వలస కూలీలు కానివ్వండి, వీళ్ళంతా కూడా కోవిడ్ ప్రారంభ దశలో మరి ప్రత్యేకించి సంపూర్ణ లాక్డౌన్ సమయంలో ఎన్నో సమస్యలను ఎదుర్కోవడం జరిగింది.
इस कोविड के महामारी के समय आपदा आई हुई थी जिसमें तकरीबन 90% हॉकर्स बेरोजगार हो गए थे.
இந்த கொரோனா பெருந்தொற்று சாதி மதம் மொழி அப்படின்னு அனைத்தும் கடந்து ஒரு மிகப்பெரிய பாதிப்பை ஏற்படுத்துச்சு.
कोविड के टाइम हम लोग कम्युनिटी के साथ डायरेक्ट कांटेक्ट नहीं कर पा रहे थे क्योंकि हमारे कुछ ग्राउंड के जो स्टाफ थे वो भी कोविड पॉजिटिव आ गए थे.
Healthcare was unavailable to most of the society and communities we worked in.
During this time, we also had the opportunity to work with CAC and Swasti, and their support was very timely and created a huge impact. Through their partnership, we were able to distribute 30 concentrators to various PHCs and government hospitals.
CAC के माध्यम से हमने लोगों में अनाज वितरण का कार्यक्रम किया, लोगों में भोजन वितरण का कार्यक्रम किया.
இதனால நம்ம புதுவை அரசுடனும் சுகாதாரத்துறையுடனும் கோவிட் ஆக்ஷன் கொலாப், வேர்ல்ஃபுல் போன்ற நிறுவனங்களுடன் நம்ம கைகோர்த்து புதுவை அரசு மருத்துவமனைக்கு தேவையான ஐசியூ கார்ட்ஸ், சிரஞ்சீவ் பம்ப்ஸ், ஆக்சிஜன் கான்சன்ட்ரேட்டர், மருத்துவ உபகரணங்கள் நம்ம வழங்கணும்.
Since COVID pandemic started, Kovel has been able to reach out to more than 10,000 needy tribal families across these 2 states.
We provided care packages to low-income household widows, destitute women, senior citizens, auto rickshaw drivers, bullock cart workers, and other daily wage laborers. We also started creating awareness about COVID so that people could stay safe. We reached around 2.5 lakh beneficiaries through our initiatives.
ஏழை எளிய மக்களுக்கு சுமார் ஒரு 1500 குடும்பங்களுக்கு ஒரு 2 மாதங்களுக்கான உணவுப் பொருட்கள் அடங்கிய தொகுப்பை வந்து நாங்கள் இங்கே வழங்கினோம்.
And even during the pandemic, we have been able to create more than 1 lakh opportunities for needy.
ఇంకోటి ప్రస్తుతం మేము పోస్ట్ కోవిడ్ రికవరీ మేము అబ్జర్వ్ చేసిన ప్రకారం రికవరీ అయ్యడానికి కారణం వ్యాక్సినేషన్ అనేది ఉండడం వల్ల కోవిడ్లో కడప వైఎస్ఆర్ డిస్ట్రిక్ట్ ఆల్మోస్ట్ 65% అనేది వ్యాక్సినేషన్ కంప్లీట్ అయింది. స్టిల్ సమ్ మోర్ ప్రోగ్రెస్ అనేది ప్రాసెస్ అండ్ ప్రోగ్రెస్ వాస్ గోయింగ్ ఆన్.
किंतु बहुत भय लगा रहा कि क्या होगा कोविड-19 लेकर के, जो बहुत आदमी मर जा रहा था, बहुत आदमी, तो ये सब लेकर के जो है बहुत डर लग रहा था. पर WW ने हम लोगों को जो है रहने के लिए हम लोगों को अच्छा काउंसलिंग किया, अच्छा आधार बताया, तो हम लोग जो है उसी तरह से हम लोग उन लोगों का बात माना.
যে একটা প্রজেক্ট পেয়েছে সেখান থেকে আমরা শুনেছি যে ওনারা আমাদের প্রচুর সাহায্য করছেন এবং পরবর্তীকালে ভ্যাকসিনের ব্যবস্থা করেছেন, ভ্যাকসিন এবং দিয়েওছেন তারা আমাদের.
సిఎసి ప్రసాదించిన ఆక్సిజన్ కాన్సన్ట్రేటర్లు, క్లాత్ గౌన్లు, కళ్ళద్దాలు, మాస్కులు ఆరోగ్య సిబ్బందికి మరియు కమ్యూనిటీలో పంచడం ద్వారా మెరుగైన సేవలకు అందించడానికి సాధ్యమైంది.
Extend my gratitude to COVID Action Collab for all the support they are extending to Kovel in this regard.
ಇಷ್ಟೆಲ್ಲ ಸಹಾಯ ಮಾಡಿದಂತಹ CAC ಸ್ವಸ್ತಿ ಸಂಸ್ಥೆಯವರಿಗೆ ನಮ್ಮ ಸೌಖ್ಯ ಸಂಜೀವಿ ಸಂಸ್ಥೆ ಕಡೆಯಿಂದ ತುಂಬ ಹೃದಯದ ಧನ್ಯವಾದಗಳು.
এই জন্য বিএনপিকেও আমরা অনেক সময় ধন্যবাদ জানাই.
இந்த ஸ்வஸ்தி, ஆர்கியோ, விருத்தி, CAC, SLPMS எல்லா நிறுவனத்துக்கும் என்னுடைய மனமார்ந்த நன்றியை நான் தெரிவிச்சுக்கிறேன். வணக்கம்.
அனைவரும் தடுப்பூசி போட்டுக் கொள்வோம். ஒன்றாக இணைந்து கொரோனாவை வெல்வோம். நன்றி.
Together with CAC, we can create a healthier and happier community. Thank you.
So let's come together, work together towards a resilient livelihoods, resilient community. Thank you so much. Hundreds. Namaskar.
We would now like to call upon a spokesperson and senior health consultant from Niti Aayog, Dr. K. Madan Gopal. Dr. Gopal is a medical doctor and public health professional working on health system reform in India for around 30 years. At Niti, Dr. Gopal has focused on several transformative programs for the health sector, including the COVID pandemic response. Dr. Gopal, we now invite you to say on this occasion.
Okay, thank you, Shankar, and thank you, Shiv Kumar, for this opportunity to join you in celebrating the milestone which COVID Action Collab has achieved. Having witnessed the COVID pandemic very closely, being part of Niti Aayog, where we have been facilitating the COVID response, along with the ministry and the other departments, it's very heartening that such an effort has happened. Initially, when the pandemic started, everybody was not clear what role people would be having. And slowly, as the things evolved, everybody has chalked out a role for themselves, and they have shown their resilience. And COVID Action Collab is a part of that. Not only vaccination, but apart from that, before the vaccination initiative, many more things have happened. If you look at the way things have progressed, we have many empowered committees which started from preparedness to the pandemic response. But one of the important empowered committee which catered to the networking with the non-governmental organizations, the civil societies, and with by our CEO, Chief Executive Officer Niti Aayog, Mr. Amitabh Kant. And where we had several meetings with the organizations where we have at least tried to understand how we can pitch in this difficult and testing time. Having listened to the experience, because we also shared the same thing when the vaccination things were going on. First, we started with the National Expert Group on Vaccine Administration, then the EG5, which the previous speaker was also a part of that. But it was very difficult task when we have explored how to bring in vaccination from foreign countries. That was also tried. Then when the indigenous vaccine came, the supply was not finite, because everybody thought that the supplies would be infinite, but the supplies was finite, and in that finite supply, we have to see how the vulnerable are protected. In this, the civil societies and the other, they have come up, they have supported, though there would be some other kind of, but wholeheartedly they have supported all the initiatives of the government, right from during the first phase when the lockdown was there, now bringing in people for vaccination. As mentioned by Dr. Agnani, that the efforts made by this collab has been tremendously gratifying. And we are very satisfied, because initially when we start, I echo the same thing. When we started, people were very skeptical, how we will be doing that. But after the announcement of the vaccination, after the start of the vaccination way back in 2020, June 2020, with the formation of a high-level committee for mapping out the manufacturing capacities in the country, started from June 2020, and the speed at which the things happened, they get expedited after our Honorable Prime Minister announced from the ramparts of the Red Fort that we would be having our vaccination soon. Then, as the things progress, we have witnessed that how the things have progressed. Now, every day, we do have the capacity to reach around 20 million vaccine doses per day. That kind of things have been evolved. initially, but the task was not easy. It is a teamwork which has happened, because having logistics, having things, having all the things, but how to bring the people. Here comes the role of the Collab, and they have done a very tremendous job. I wish the Collab all the success in the coming things. We see that when the vaccination is open for the children, they do have a role to play in that as well. I stop here, and I wish all the best, and whatever cooperation is required from end, we are there to help you out. We are all sailing in the journey together. Thank you very much.
So thank you very much for joining us today, and really energizing and your enlightening thoughts that could shape the future of the health sector. Thank you so much once again.
Thank you, sir. Echoing the theme of concern for humanity above all is one of CAC's donor organizations, Skoll Foundation, which has helped provide flexible funds to build community resilience. This gave us all the freedom to go to areas of greatest need and comprehensively tackle the most intractable challenges facing our communities. This gave us the platform to create innovative, first-of-their-kind solutions that are creating impact at scale today. In this way, by redefining trust and empowering the social sector, Skoll Foundation has emerged a true pioneer in the donor ecosystem. Representatives from Skoll Foundation could not be live with us today due to time zone differences. However, we do have a message from Ben Pine, Principal at Skoll Foundation. Over to you, Ben.
Hi, everyone. I wish I could be with you live, but it's such a privilege to share a brief message of gratitude with you all. My name is Ben Pine. I'm a principal at the Skoll Foundation, and the Skoll Foundation catalyzes transformational social change by investing in, connecting, and championing social entrepreneurs and other social innovators who together are advancing bold and equitable solutions to the world's most pressing problems. So naturally, one of our biggest focuses before, during, and hopefully after the COVID-19 pandemic is pandemic preparedness and response, as well as health system strengthening. And these past couple of years, we've had the real privilege of partnering with the COVID Action Collab and the Catalyst Group in supporting this network's life-saving and livelihood-saving work for the most marginalized in our communities. We've supported the COVID Action Collaborative overall, but we've also supported individual projects from members of the collaborative that are supporting health and economic resilience, and also supporting an innovative pilot for environmental and wastewater surveillance in the state of Karnataka. And today I just wanted to share my congratulations and our deep gratitude and admiration for this collaborative reaching over 10 million people through over 300 partners. This model of radical collaboration, of solidarity, and of trusting those that are most proximate to the problem to lead the change really should be celebrated. And we have deep respect for how the partners across the collaborative have served vulnerable populations during incredibly taxing COVID waves across India. And this collaborative demonstrates to the rest of the world many of the qualities that are needed to bounce forward from this pandemic and build systems that are resilient to future shocks and that are designed to serve all. Thank you all. Great to be with you.
Thank you, Skoll Foundation, for being a role model for collaborative philanthropy. Your trust has enabled us to incubate 22 Impact Canvas solutions like VaxNow, Pandemic Plastic, and Precision Health, many of the speakers before this have also mentioned and spoken about. Most importantly, it has brought a shift in the paradigm of the systems available for disaster response. And we hope to leverage this systemic change for sustained impact for people and the planet well beyond the pandemic. Now, it's my pleasure to introduce Child Survival India. Child Survival India aims to empower marginalized communities by enhancing their knowledge, skills, capacities, and decision-making. CSI acts as a catalyst and facilitator to help people live with confidence and dignity. It's a privilege to introduce Deepa Bajaj, the executive of Child Survival India, and a child development professional spearheading CSI for the past 24 years. She has extensive experience in public health issues, especially in urban poor settings in India. She's a strong advocate for leadership and agency of women and girls for developing a more equitable society. Deepa Bajaj, over to you.
Thank you for giving me this opportunity. I really feel very humbled and also feel very proud to be part of the COVID Action Collaborative and the kind of achievements we have together been able to do in the past 2 years. She has already introduced Child Survival India, but just to briefly talk about it, it's a 31-year-old organization, and we have a footprint in 10 states, including Delhi, Andhra Pradesh, Tamil Nadu, Karnataka, Telangana, Haryana, Punjab, UP, and we reach out to about 1 lakh people directly every year. Our association with Collaborative started in May 21, and the best thing that I liked about being part of the COVID Action Collaborative is that our team got a lot of support for building up its capacities. As everybody has said, that COVID-19 pandemic was the biggest challenge for all of us, and especially the organizations very close to the grassroots, because we ourselves had a lot of doubts and our team were not ready, because the pandemic was something which we had never faced earlier. So I, as a head of the organization, I was also very scared. Like when the first lockdown happened around 24th of March, and since we do a lot of work with truck drivers, we realized that many of our truck drivers, they were stranded on the highways, they had no support, no ration. And at that time, when we decided that we'll be going out with dry ration kits to the drivers, I was not very sure whether I can ask my team to be in the field in current situation. So the kind of trainings we needed at that time to prepare our organization and to prepare our teams, that is something that I would say that being part of the collaborative gave us. We got all those trainings, and we also got that strength that we are in it together and we can go ahead. So that is something that I would say that being part of collaborative helped us. And then each of us had its own strength, all our NGOs, and collaborative helped us to share our resources, and we could forge partnership between the NGOs and also with the corporates, because we needed funds at that time to go ahead and to provide the support to the communities that needed it the most. So I would say the collaborative helped us, helped organization like ours to forge that collaboration with the corporates. And along with that, I'm really happy to share that collaborative also motivated us and nudged us to go forward and to raise more funds. And we were also motivated to apply for Grow Fund, and happy to share that we are one of the 100 organizations that has been selected by Grow Fund to support. Because if we have to build the resilience and sustainability of the organization to take up the challenges, the kind of challenges that this pandemic has given to us, I think we need to build up the organization. And we've been lucky and fortunate that we have been selected for the Grow Fund. So that is also something that I would say that Collab motivated us to apply for it. And the best thing that I would say is that all of us, my previous speakers have also been flagging, that given the nature of the pandemic, we needed to respond immediately, urgently, and the kind of agility it required. So working with collaborative, I realized that it does not have the kind of bureaucracy that one usually has in any other partnerships or in collaborations. Here, people were like hands-on, and we could, whatever support that we were asking for and maybe developing into proposals, we were getting support readily, and there was no such bureaucracy, because that was the need of the hour, that we had to respond urgently. So I would say that COVID Action Collaborative, they responded to that need of organizations, grassroots organizations like CSI, and that is what helped us. And we could multiply our reach, and we could reach out with the much needed services, or you can say critical things that our community needed, whether it was dry ration kit, whether it was home care kits, even to the frontline workers. We got some in-kind donations from COVID Action Collaborative, and we could provide kits to the frontline workers like the ASHA workers and the Anganwadi workers so that they could do their work comfortably in terms of oximeters, in terms of masks, and all those things. And one more important thing that I would like to highlight is like we had integrated COVID related awareness, we were motivating people for vaccination, but I would say COVID Action Collaborative helped us to systematize our response and to document our response. And that is how we have been able to facilitate vaccination of about 32,000 community people with whom we work, and we've been able to provide vaccine readiness to around 49,000 people. And that response has been systematized because of the trainings that our team received and on the app also, and we could document our work. We were doing it, but we were not documenting it properly. So I think that is also very important. And going forward, I would say, as everybody said, let us be in it forever. And this kind of collaboration is something that is really needed for grassroots organization like ours, because if we are part of a collaborative, it gives more credibility to us, it gives more strength to our team. It not only helps us in building up our capacity, it will also help us to raise more funds and to take up projects at scale. So I would say this collaborative should continue, and as let us be in it together. And I would say it has helped us to forge partnership with the public sector, with the government also. So this kind of public, private, and civil society kind of a collaboration that we have been able to do is something that collaborative can further strengthen going forward. Thank you. Thank you for giving me this opportunity to share my views here.
Thank you. Thank you so much, Deepa and CSI, for your deep commitment and meaningful actions in helping vulnerable communities during the humanitarian crisis. Here's to motivating each other, learning from each other, and doing so much more together by combining our strengths. And speaking of combining our strengths, there has been unprecedented incentive and motivation, you'll all agree with me, like Deepa also mentioned, for the public and the private sector to come together for disaster response. In this next segment, the lead of our telehealth impact canvas, Radhika, and our in-house gender expert, Shauli Chakrabarti, will be celebrating some stalwarts of impactful public-private partnerships and their lessons on the journey. Shauli and Radhika, over to you.
Thank you, Meghna, and a very, very warm welcome to everyone. Having worked in the COVID Action Collab Secretariat since last 2 years, it is my honor and privilege to moderate this panel of public and private sector collaboration along with my colleague Radhika. We truly witnessed the power of public-private civil society partnerships and collaborations like never before during this pandemic, despite the tremendous crisis we all encountered across our families, our communities, country, and worldwide. We could successfully engage with 23 local governments across 12 states and union territories. The government is the most critical agency and the partner in humanitarian crisis, playing pivotal role in formulating and responding to effective responses and policies. Our intent and strategy for engaging with local government has evolved over time, especially during the progression of the pandemic waves, based on local and national situations. With government and private sector, we have explored and demonstrated solutions to hyperlocal problems, identifying and connecting resources and solutions, integrating systemic responses. Our partnership has been instrumental in streamlining and generating evidence-based responses and outcomes. As a collaborative, we believe in such intersectoral engagements and collaborations have laid the strong foundations for future humanitarian crises on mitigation, prevention, and response. Today, we have an esteemed set of panelists representing the local government and private sector across India, and it is our honor and privilege to hear them today. I'm extending a very warm welcome to all our panelists and attendees again here. I'll first request and introduce Ms. Rinjim Jain, who is a consultant to Women and Child Welfare Department, Delhi from United Nations. She has 15 years of cross-sectoral experience, currently working as UN Women's Technical Consultant, ending violence against women in the Women and Child Welfare Department, engaging in strengthening public services and policies to support women survivors, and developing schemes and programs for women's empowerment. Rinjimji, can I ask you what are the critical challenges that was faced by your department during the course of pandemic, and how did you leverage the intersectoral collaborations to address them, especially for the most vulnerable communities, including women and children? Over to you, Rinjimji.
Yeah, thank you so much for this. And it's a great pleasure to be here among this esteemed panel. Thanks a lot for this. Of course, the pandemic in Delhi and the health impacts of the virus, as well as measures like public restrictions and the lockdown, it has created a context in which meeting the needs of safety, security, access to even food, health and essential services, as well as the rights and entitlements of women, girls and children are very, very important considerations. And the WCD department in Delhi, where I am embedded as the UN Women Gender Expert, so that is one of the mandates of the department is to provide and to look after the needs of particularly marginalized women and children in the state of Delhi. And we, of course, realize that it is essential that all stakeholders recognize that women, girls, and children are in a highly vulnerable situation during this time. They face socioeconomic discrimination, also gender-based violence, because as we know, disasters always deepen inequalities and vulnerabilities. So it is very necessary that all efforts are converged to create an enabling environment for them and to uphold their safety, minimize the risks to them, and also immediately ensure sort of, continuing redressal and flow of resources. And why this became particularly important, of critical importance in a way, was because the systems were completely preoccupied with fighting the pandemic as a health emergency. So cognizant of this situation, the WCD department took steps to ensure the continuation of essential services at all levels and respond immediately to those at risk. So the measures included both short-term, if I may say, as well as long-term emergency response plans, which took into account the safety and undisrupted supply of services. This was also balanced with ensuring that we were engaging women's voices in instituting processes during the pandemic for meeting priority needs and longer-term resilience. So the aim was to minimize problems for women and children and their unhampered access to services and resources despite the COVID-related disturbances. So for instance, the WCD department has the mandate of implementing the ICDS, which is the Integrated Child Development Services. So under the ICDS, the department is running almost 11,000 Anganwadis across all districts of Delhi. Yes, it was very difficult to run them during the COVID restrictions. Not only was it difficult for the Anganwadi workers and other functionaries to reach the centers, but even the health services, the supplementary nutrition, the food which is provided to children from 0 to 6, as well as to pregnant and lactating women, all of that was very, very badly hit. So what happened was that there was a move to introduce protocols, adapt to the emerging situation, speak to resource experts, speak to civil society groups. So there was this Delhi COVID relief and response gender group that was set up with almost 40 different stakeholders from resource organizations, civil society, academicians, all of that. And it was divided into different themes. Thematic task force working groups were set up. And based on that, a work plan has been developed and the department has been moving forward. So basically, as part of the accountability towards women and communities in fostering an environment of gender equality and protecting the rights and rights of children in all contexts and situations. So a sort of threefold approach is being focused upon. One is to strengthen the existing services and address challenges in ensuring uninterrupted continuation of services and resources. So the ICDS is there, as I mentioned, plus The department has a lot of childcare institutions. It has women's shelter homes. It has one-stop crisis centers it runs. There is the district level centers for women. There's a range of services at the ground level for women and children. So there was definitely a lot of challenge in continuing that. Then secondly, it was also there was a need to proactively meet emerging needs and to have a preventive approach, because there was this increase of gender inequalities and greater gender-based violence against women and children. And the third sort of multi-pronged approach was to link services with partnering agencies and convergence of efforts with civil society groups. And that is where also we worked with the CSE, and this collaboration was instituted. And I think basically this resulted in identifying what are the needs and the challenges of beneficiaries. That was the first thing, a mapping of needs, challenges, collaboration with the frontline functionaries who are very closely embedded in the communities. They are the ones who know exactly what is the emerging situation, who are the most vulnerable groups, families, what is required. So there was this communication process, a ground up communication and an interface that was established between the department's functionaries, the department at the headquarter level, and various civil society organizations and collaboratives such as yours, with the purpose of providing social protections and services. Then was instituting protocols for the department and related stakeholders to respond to the current situation of the pandemic, and to develop guidelines, to develop focal points for preempting the risk of reallocation of priorities away from women and children, because this was a time when there was a lot of competing priorities from different sectors. So it was very important to bring forward the voices of women and of groups like children, who in any case are generally much more invisibilized. So to bring that forward, to ensure also that this was through a process of mobilizing women's, collectives, communities, all of that. So that process was brought into play. Then there was a lot of capacity building, orientation, and dialogue with the department's own frontline functionaries and partners, stakeholders, others, the whole external world in a way. There was also a lot of, we brought in this entire integrated system.
Sorry, can I, in the interest of time, can I request that I go to the next panelist and come back to you?
Yes, absolutely, absolutely. Yeah.
Thank you. I think despite all the challenges, there's tremendous amount of effort, but I think it's a new kind of endeavor we have started. The challenges remain and it has aggravated. So really looking forward to more such, deeper impacts. Thank you so much. With this, I would like to invite Mr. Saju Wahid. It is my honor to introduce him. He is the IAS District Collector of South Tripura from the northeastern state of India. Shri Saju Wahid, he is Indian Administrative Service Officer of 2015 batch and has served as the District Magistrate level officer as Director of Higher Education, as well as State Project Director Samagra Shiksha Abhiyan. He is currently working as District Magistrate of South Tripura and is a very popular administrator among the people of South Tripura. Wahidji, may I request you that to share your insights and views. We have demonstrated excellent collaboration with your department. Can you please tell us a little more about what kind of challenges you encountered and how did you kind of leverage this collaboration to address them?
Thank you, Shamali, for giving me an opportunity to discuss in this forum and share our experiences among the other panelists and also those who are listening to this webinar. Being a district administrator and being a magistrate here, we were leading the whole activities against the COVID action for the last 2.5 years. So initially, I got posted as district magistrate only 1 year back when we were about in the third wave. Before that, I was in director of secondary education. So whatever we say that that COVID, the major impact it created on the health service itself, and also the officials who were working there and the staff who were working in the health department was heavily had to work during this pandemic time. So in the being an, we were able to see the wave happening in the mainland of the country, be it in Kerala or Delhi, and also we were having relatives and friends struggling there during the high time of the COVID. So we were having enough time to prepare. So the major gap which we found is that the health department is completely stuck with the whole kind of asymptomatic patients coming into the health facilities. So they were not able to manage with their serious cases and the non-serious asymptomatic cases. So the major important thing which we had to intervene is that keeping the asymptomatic patients at home and give them proper care. So it was implemented across the country that home isolation should be done. But being in the initial phase, I was also down with COVID. What I have faced is when I was down with COVID, nobody called me, nobody asked me what is your problem, what medicine you had to take, and what all these things. Then when this came, so I thought that this is a major gap where we have to intervene at the proper place and call the people at the home isolation to take care of them and to tell them what you want, what you don't need. So the previous speaker has told about the risk in bringing the food and other facilities. So what we brought is like we set up a call center in 1 or 2 days. So setting up a call center was also very difficult. So we used the facilities in the schools. The ICT labs were there. So we used the teachers as their volunteers, and then we started the work. And we started calling on a daily basis all the home isolation patients and asked them, what is your problem, for the continuous 10 days. So that made a major change, that reduced the patient struggle, patient load in the hospitals, and the doctors were able to focus on the real patient rather than the asymptomatic cases coming into the hospital and calling the doctors, like unnecessarily calling because of their concern. So we were able to reduce it down that time in the first wave. In the second wave, bringing the teachers and other volunteers again and again is difficult for them also. The online classes have started and there were exams, they were having so many problems. So the government officials taking them as volunteers was very difficult. So even we tried our level best to take them to the field hospitals or to remote areas was difficult. So now engaging the volunteers and paying them, that was a second issue. You know that in government, the all audit and other things happen when all the wave is gone over. So bad time, all these things will be questioned. So we have to manage volunteers and have to pay them, have to give them food, and all the process, all the protocols, all the rules have to be followed. Otherwise, during the audit, they will be asking why you have not followed the process. So that was the second challenge which we faced. During that time, the CAC and other voluntary organization come forward and said that, sir, we don't want any money. But that time the challenge was that to onboard them on a suddenly basis. Like we were what we say, we are pressurizing them that we want to onboard 100 people today morning or tomorrow evening. We don't have time. So you have to onboard. Sir, I can arrange 50 or 100. I want that many number of volunteers on a day-to-day basis, and they have to report. And this kind of, and you have to mobilize this many number of technically savvy volunteers all on a sudden. And being a district in Northeast, being a state in the Northeast, it is very difficult to get this technically qualified people. So we had to use volunteers of 10th pass, 8th pass, and within a minimum amount of time, 1 hour, 2 hours of training, we had to onboard them as volunteers, computer operators. So thereafter, another challenge came. We had to do testing. Like we had done testing for 10,000, 20,000, 15,000 number of tests daily. But side by side, we have to do the data entry into the system so that the top level officials or the government of India can see, or the whole world can see how many tests we have done. So we have to do the data entry. That is a major chunk, which is not even considered about. But doing a data entry is a very big task, and you need people who know. We need people who know proper data entry operations. And when you go to the remote belts, where there not be any mobile network, there won't be any internet, nothing will be there. So we have to collect on the paper, bring back home. The whole day you will be traveling across the remote villages, and in the evening the volunteers will come back and we will pressurize them. How many have you done? Sir, we have done 1,000. Where is the data? Do the entry into the data in ICMR portal, in that portal, this portal, COVID portal, state portal, central government portal, so many portals and so many data entry. and the next day there is another message coming, you don't have done any data entry for this particular area or that particular area.
YJ, thank you for sharing these challenges. I mean, again, in the interest of time, we have a private sector panelist here. We would like to hear from also that how then, these challenges could be addressed together. If you allow me to kind of, have in for 2 minutes and then hand over back to you if you have any other comments. Thank you so much.
Thank you, Shirley. With that, I'd like to very quickly introduce Mr. Abhishek Gopalka. Mr. Abhishek Gopalka is the Managing Director and Partner of Health at the Boston Consulting Group. Mr. Gopalka's team has actually been doing some incredibly interesting work during the time of COVID, especially with the COVID Action Collab. But in the interest of time, Mr. Gopalka, I'd really like to understand from you. Obviously, the COVID pandemic has strengthened the relationship between the public and private sector enormously. What do we need to do to sustain this in the long run? Because this momentum should not be lost. So what can be done to sustain this, and what are some legal and regulatory frameworks that you recommend should be considered as we move forward?
Well, first of all, Radhika and team, congratulations to the entire CSE team. What you've achieved is phenomenal. And Radhika, I'll just build on what you're saying. I think this whole essence of collaboration is something which really came about in the pandemic. And I fully agree that it would be a tragedy for it to not sustain beyond the pandemic. I think two major points that I would like to highlight. Number one is really institutionalizing these kinds of conversations and setups. Very often a lot of the planning and thinking in government, and we were hearing from many of the government officers before this and after this as well, is very top down. And I think it's really important to bring in those grassroots insights when we are planning and designing, and also for implementation support throughout. So what is a structural mechanism to be able to involve multiple stakeholders in designing, planning, and implementation throughout is going to be very important. For example, we've seen certain states where chief ministers create a chief minister advisory council. And these councils are institutionalized and they're multi-stakeholder by definition. This happened during the pandemic also, and it needs to happen going forward as well. The second is just the role of NGOs and private partners as well. And it needs to become easier and simpler for them to play a role. Very often the private sector is looked at from a source of funding perspective, but it's not just about funding. It's about capabilities. It's about innovation. We've seen a lot of innovation in the last couple of years. And that's that classical, necessity is the mother of innovation and invention kind of a phrase. That needs to become institutionalized as well. So for example, many smaller organizations find it harder to get government contracts. So we really need to look at those institutional frameworks. We'll be looking at tendering processes, eligibility criteria, portals like GEM portal, and just make it much, much easier for innovations to be discovered and for economic models to be created for them to be able to partner with government going forward. So it's really a question of discovering these innovations and mainstreaming them going forward. I think what CSE has done is a great start. There are many such examples, and they absolutely need to be sustained.
Thank you so much, Abhishek. I think just one last point that I'd like to highlight. When we were talking previously, you talked about how the role of BCG was actually very unique in that it wasn't just about funding. You all played a number of different roles. Is there a case to expand the definition of a PPP beyond a PPP, include another alphabet into that now?
Absolutely. So I think, as you mentioned, there are multiple different organizations coming together. I'll give you an example from something we were partnering with CSE in Tamil Nadu, where there were many remote districts where the vaccination levels weren't as high. And so what we really brought together is a partnership of government who were providing the vaccines. CMS CAC had really mobilized a lot of grassroots organizations to bring in a lot of the community mobilization aspects. And there were private players like Give India, who were then funding other private entities like Vaccine on Wheels, which were running mobile vans to reach those remote areas. So there were actually 4 or 5 different organizations coming together in a very unique kind of collaborative model. That's the kind of examples which need to move forward as well.
Thank you so much, Mr. Abhishek. I think, your insights have been incredibly valuable and, set the stage for the remaining panel. I understand you're at an offsite. So, thank you so much for staying with us for so long.
Thank you.
With that, I'd like to bring in another unique example of, the role that the private sector has played. The role of the private sector has not just been about funding, but also looking out for their own employees. And one such organization that did this beautifully was actually Aqua Automatics, an MSME located in Pune, Bangalore. And we have Mr. Chabria, the MD of Aqua Automatics, with us here today. He's an industrialist by profession, a social entrepreneur by heart. Mr. Chabria, we'd love to hear from you a little bit more about what you did for your employees during the time of COVID, and what was the role that the COVID Action Collaborative played in that? You're on mute, I'm sorry.
Thank you, Radhika, and thank you everyone for having me here today. It's a unique honor and opportunity for me to share my views of what the COVID Action Collab had done for us. When the pandemic hit in the first time, everybody was clueless as to how to go about it. That's what Deepa Bajaj had also mentioned earlier in this particular talk over here. And likewise, I was also clueless on this entire thing. And that's when the COVID Action Collab got in touch with us and said that, look, we have an offering that we can take care of the needs of the people by taking care of being in touch with them and giving them the necessary support. And that's when I found it interesting. And since human capital is very, very important to me, I had kind of signed up with Swasti, and we had started this entire process. So the results have been phenomenal. And if you'd like, I can continue talking about it. But if you have another question, I'd be happy to answer that.
Thank you so much, Mr. Chabria. I think it's very interesting that you found a lot of support from a civil society organization that came into at a time that was very, very timely for your organization. What I'd like to understand from you is, what was the role that you think the public sector played in this? Obviously, being an MSME, you interact very closely with the MSME space in the government. You interact very closely with the ESIC. How do you think that response was, and what support did you receive from them?
Well, the public sector was under strain at that point of time. The governments were under strain and everybody was equally clueless. So till the entire policy formulated, I think it was each one to himself, and that's how it happened. So we had kind of taken out an insurance policy for our employees, wherein even if they were covered under ESI, because ESI was not very sure whether it's going to take into case the COVID cases coming in, though that was clarified much later. And I think in the second wave of the pandemic, that's when ESI started really helping out the people with the COVID and this thing. But otherwise, we had taken out an insurance policy and given it to all the people. And those are the compulsions of that time that, governments also could not really react. But I think overall, the government has done a brilliant job, and I have nothing to complain on that.
Thank you so much, Mr. Chabria. So with that, Shauli, it would be lovely to hear a little bit more from the public sector again about the initiatives that they've taken up. Thank you, Mr. Chabria.
Thank you. Thank you. Bye.
Thank you. And with this, I would like to introduce, the next panelist, who is Mr. Rakesh Kumar Jaiswal. He is IAS District Collector, Dholpur in Rajasthan. He's the first collector who's a promotee IAS in the Board of Revenue Ajmer, and he's a 2000 batch officer posted as additional district collector in Dholpur district from the year 1999. Jaiswalji, thank you for being with us and patiently waiting for your time. Thank you. Can you share your insights and learnings of working during this pandemic with COVID Action Collaborative and the public-private civil society partnership? Over to you, sir. May I request, sir, we can't hear you. You have to unmute and speak. Apologies for this confusion. Jaspalji, can you hear us? Can you please unmute and speak? And also switch in your video, please. Okay, I think we are having some technical difficulties with Jaspalji there. May I request our next panelist, Mr. Vikram Kumar Minaji, are you there? Sorry, Vishram Kumar Minaji, are you there? I'll just check. I think there's some technical difficulties. Okay. I think Radhika, I'll hand over back to you. There probably are some technical difficulties here. So we'll just hear back more from our private sector representatives, and then we can hand over back. Thank you.
Sure thing, Shali. Thank you. We have a very interesting gentleman with us here today, Mr. Arun George. He's a CSR lead at Big Basket, which is a Bangalore-based company. Mr. Arun George, we'd love to hear a little bit more from you about the kind of work that you put into not just your own employees, but your entire delivery chain. We'd love to hear a little bit more about the initiatives that you as a private sector company took up at a very difficult time like the COVID-19 pandemic.
Hi, good morning, everyone. Am I audible?
Yes, you are.
Yeah, okay. Thank you. Thank you for having me on this panel. Big Basket, as you know, that we are one of the basic commodities, what people want, right? So during the pandemic, actually, there was real crisis for us. And of course, which reflected back to the customer also, right? So our basic aim was to get our delivery staff, or delivery executives, quickly vaccinated, so that because they come in contact with the customer, right? They carry the products, and that was initially that was the source of spread for COVID, right? So we had to take more care in that area. So that's what we had aimed, and that's what we achieved in the initial stages. And how we went about it was that we are located pan-India across about 120 units across pan-India, both including Tier 1, Tier 2 cities. So all these locations, they had collaborated with the local health department, right? And they had created, the health department had set up camps in each of our units, right? So that it is easy, much easier for the employees to get themselves vaccinated. And also it doesn't disrupt the normal working business also, right? So whenever they are free, they can go and take a jab and get on with their work, right? So that's how we had initially handled the vaccination part of it. And of course, the second, I think it was the second wave. During the second wave, we had collaborated with CS, and that's when we had kind of extended our support in terms of providing a vehicle, right, to help in vaccinating our partners like street vendors and local Kirana partners. I think that was a great effort put in by our collaborators, and I think it was quite a successful thing in helping our partners get vaccinated. I think right now, as of now, in Big Basket, we have about 99% fully vaccinated all our employees. Yeah, that's it for me. Yeah.
That's lovely to hear, Mr. Arun George. It's a brilliant initiative, and it's a great use of resources you already had, right? You had those vans,
exactly.
You deployed them, really, really brilliant.
Exactly.
We were talking about this yesterday as well, and traditionally the role of private sector has been to fund organizations, but this has been changing a lot over the course of the pandemic. How do you see this role now play out? What do you think could be some ways that you as Big Basket could potentially involve civil society organization, involve the public sector as well?
No, as see, we are kind of new to CSR activity as such, right? So we are a 10-year-old startup. But then since we have the reach, I think many private sector online companies also have vast reach across pan-India. This, I think, we are trying to get to use to help NGOs, right, kind of join with us or partner with us, and to showcase what type of work they're doing in various areas of across the country, and how they can or how they will need support, right? So we can kind of give them visual space so that they can reach maximum areas across India. That is our initial thought on CSR. And of course, it goes how we also have to kind of collaborate with the partners on what are the areas we would like to work with. So that's how we are looking at it. I think this kind of scope is available with many private sector companies wherein they have a lot of reach across India.
That's lovely. Thank you so much, Mr. Arun George. It's lovely to see you leveraging resources like the platforms you have, the vehicles you have to truly support initiatives across the country. Thank you so much for your time to be with us today. Shauli, we'd love to hear a little bit more from the government side.
Thank you so much.
Thank you. I think after a bit of technical glitch, I think Jaspalji is with us. Jaspalji, आप हमें सुन सकते हैं?
Yes, I can hear you, ma'am.
Yes, I can hear you. Can't see you.
First of all, I will express my thanks for giving me an opportunity to take part in this discussion on COVID management and experience, and share my experiences and my views. Dholpur is a very backward district located in southeastern Rajasthan, and it is in close proximity of MP and UP. Rather, both the states are 30 kilometers away. We had to face a number of problems while dealing with this COVID management. First and foremost thing was that the entire medical system, there is no private hospitals who could deal with this emergency. 95% of treatment is already being done in the government hospitals, and they were suffering from resource constraints. There was a lot of shortage of doctors and nursing staff, and there was a lot of panic in the first stages because people were afraid that mere touch could render them vulnerable and could make their life very difficult. So we had to initiate a lot of IC activities to sensitize them that there is a problem and it has to be dealt with. And the first thing that has to be done was to reduce the number, the crowds in the market, in the vegetable market, in the banks and the post offices. So we did spread a lot of IC activities that the number of persons movement has to be brought down. Poverty orders were issued under CRPC that not more than 5 to 7% will assemble in the shops. Also, the number of persons will were kept to minimum. So this panic management was one aspect that it did manage. And as regards doctors and nursing staff, we employed persons from the private hospitals and from other spheres, so that we were in a position to deal with this contingency. Besides, we have the problem of inflow of near about 50,000 migrant laborers who started pouring in from different parts of the country. So when they started coming from very vulnerable areas, then we ensured that before entering their villages, they were all screened, and their management stay was managed in schools and dharamsalas, so that they did not carry with them the infection and spread it to their families. And I'm very happy to tell you that all the families, they did a lot of cooperation, and they spoke to their families well in advance that before you come to village, kindly stay in the facilities that have been provided to government, so that the infection does not spread the families. They were aware that if they come to their families, they will carry the infection and they can make life difficult, especially for the older persons. So this was a big success that we had during the entire process. And the things that we did, steps we did take, we made a innovation that initially this whenever a patient goes to a hospital, he has to get him registered, he has to have a OPD slip. So we innovated, and we now ensured that this OPD slip could be issued from any e-mitra counters in any part of the city. He did not come to hospital to get him registered. So this reduced the long queues that we were having in the hospitals. And besides, another problem that we had on our plate was that the banks and post offices were having a lot of crowds. Pradhan Mantri had announced a scheme whereby some monetary compensation was given. So they are coming to withdraw that amount. So we had to go in for a door-to-door pension distribution system. I employed around 455 banking correspondents of banks, of CSCs, of Indian Post Office, and they went in in every village, door to door, and that action was very instrumental in reducing pressure on the banks and the post offices. We also employed the services of the volunteers. Another problem that we were facing was the ration distribution. During this crisis, when people had been deprived of their livelihood, then this ration system became the source of their food system, and they were coming in huge crowds to those distribution shops. So we ensured that they were given some tokens, and then time and date were mentioned in those. So that served as a curfew pass also, and they came on the assigned dates, on the assigned time slots, and this reduced the pressure on our system. Another problem that we are facing, and about which not much could be done, was the sabji mandis. During the morning hours, there are a lot of crowds in the sabji mandis because there is a system where wholesale operation takes place in mandis. People from all over the city and all over the villages, they come, from other parts of the state, they come, sell their vegetables. So we had to locate them to farther distances so that there could be some social distancing. And this mechanism initially created a lot of discontent in the people and the community. But later on, they reconciled to this view that to save their lives, they have to make some compromises. I am very happy to say that this mechanism succeeded to a large extent in reducing the crowds, because reducing the crowds was one mechanism that was employed in the initial stages to save us from this spread of this infection. And because of this, we were successful in reducing the positivity rate. And it being a very good backward district, still this positivity rate was only 3.5% as compared to other parts of the state where it did go beyond 10% and more. Besides, knowing that people had been deprived of livelihood, especially the migrant labor which were coming from Kerala, Andhra, and Tamil Nadu, others places to their own state. So we spread this Narega work and employed to the tune of 1 lakh persons per 1 lakh mandates per month, so that they could get their livelihoods. And another major challenge was how to identify them early, so that prompt treatment plan could be done and their lives could be saved. So we constituted around 2,000 screening forces, and those screening committees did play a better role. Early detection was possible, and while doing that, we also ensured that medicine kits were distributed, and they were told that in case they have any problem, symptoms, then kindly take the medicine and go in for the home isolation. So that succeeded in a large extent in reducing the pressure, because we were knowing that we are having certain constraints. Our hospitals were very small, not capable of handling huge crowds. So only cases which required medical attention and hospitalization, they will be handled here. And we created a chain of COVID care centers all over the district. So the persons with mild symptoms and asymptomatic persons, they could be dealt with there. So this also helped us in facing the situation. Community kitchen was another mechanism that we employed. When we are having, there is an issue that there is only 35 kilometers of corridor between UP and MP. If a person travels from Agra to Murena and Gwalior and MP, he has to just pass by 35 kilometers. But when I went to these places, then we found that they were having some problems. So we created community kitchens, we created a new system of voluntary groups, and those systems were helpful in reducing the pressures and were of very immense help to persons who are migrating from one part of the state to another part. Another thing that we did in the initial stage was the comprehensive sampling strategy. We identified the vulnerable groups, and we went in for early detection and the prompt treatment. We also did the contact and travel history of persons who were coming or traveling on the highways, so that there was no problem. And besides the medical facilities at the district and sub-district hospitals and the community, CSCs, they were upgraded, ICU beds and the oxygen supply. These were two main things that we did pay attention to. And besides, we upgraded this availability of medicines and logistics.
Jaspalji,
Yeah, ma'am.
in the interest of time, sir,
Yeah, ma'am.
can I request
I'll wind up my discussion. Oh, ma'am. I'll wind up my discussion. In the second stage, we had certain problems of oxygen management, and we did a lot of this thing. Initial stages, we got procured number of cylinders, and we created ICU beds, and with all that, we were successful in managing the situation. In the second stage, number of deaths in our district was very low, and besides, there were no referrals to Jaipur and other parts where normally people used to go. Finally, I'll say that with the help of the community and NGOs, we were able to manage the situation. And I will also make a request that if Dholpur is a very small district and is a part of an aspirational district, we'll request that if some funds could be provided to fund the projects, this we will appreciate. Thank you very much.
Thank you so much, sir. I think I would like to thank all our government representatives here. The amount of tremendous pressure that you have taken during the pandemic and the heroic efforts that you have put across, and also your agility and, your acceptance to intersectoral collaboration. Thank you so much for being with us today. It has impacted lives and livelihood, and because that's the most important part of our endeavor. And I'll now hand over to my colleague Radhika for the next section.
Thank you so much. On behalf of Shauli and myself, we'd like to thank all the government as well as private sector panelists who took the time today to speak with us and really emphasize the power of public and private collaboration. With that, I'd like to hand over to Meghna and Shankar. We'd love to hear from the rest of the panels. Thank you.
एक्सटेंशन हम तो भगवान से गुजारिश करते हैं 2 साल के लिए एक्सटेंशन हो जाए फिर हमारा साथ रहे
झोला पकड़ लेंगे और झोला पकड़ लेंगे कोई सोशल वर्कर.
Thank you, Radhika and Shauli, and thank you very much for private and public sector panelists for an insightful and engaging discussions. Initiatives that blossomed from private and public sector collaborations like telecare, social protection, have offered a lifeline for those who would have no other ways to receive assistance. Here is to keeping the fire of collaboration burning for the betterment of the society.
The pandemic was indeed a challenge that maimed us all, but all our partners here today converted this challenge into a chance to come together and act together, as we're seeing throughout this segment. The seeds we have sown over the last few years, both individually and collectively, will help grow flowers for our communities well into the future. In honor of these efforts, we would like to recognize a host of partners over the course of the event across critical categories like social protection, enabling COVID awareness and resilience, vaccination, and telehealth, among others. To start off, we'd like to recognize the partners in the special category of home isolation training, elderly essentials, mental health design, research, and other behind-the-scenes work to support and reach the last mile.
Congratulations, partners. While there is a lot of intent in the development sector to help vulnerable communities, One of the most heartening things we see is champions from these communities taking charge of their own recovery and resilience, be it sex workers, trans people, fisher folks, and informal workers. We have seen many such shining stars who stepped up during this crisis and spread the light and held the hands of people who are in need, despite their own struggles. We are here today to recognize these stars and celebrate their resilience and achievements in the face of adversity. We have the opportunity to listen to these stories of 3 community champions, Suman, Jayachitra, and Ujjwala Patel. My colleague Annapurni will facilitate the discussion with these champions. Annapurni, over to you.
Thank you so much, Shankar. In the public-private partnership section, we heard from the leaders about all the measures that were taken by the private sector as well as the government to help people on ground. Now we're going to hear voices from community leaders on the efforts that they have taken to build resilience among their communities. So in this context, it gives me great pleasure to welcome Sumanji, who is an ASHA worker from Alwar, Rajasthan, Jayachitra ji, who is a culinary expert from Madurai in Tamil Nadu, and Ujjwala ji, who is a board member of a fishery union from Mumbai, Maharashtra. A warm welcome to all of you. My first guest, that is Sumanji, she is from Kishangarh Bagh in Alwar, Rajasthan. She has been an ASHA worker for the last 14 years, conducting health surveys, ensuring maternal and child health, nutrition, and she also educates adolescents on reproductive health and maternal health. Sumanji, नमस्कार, आपका इस पैनल पे बहुत हार्दिक स्वागत है। हम ये चाहते हैं कि आप बताएं कि इस कोविड पैंडेमिक के दौरान कम्युनिटी में क्या-क्या मुश्किलें आई थी और उस मुश्किल से का सामना करने के लिए आपको सीएससी की तरफ से क्या मदद मिली, उस मदद से क्या बदला है, कम्युनिटी की सोच बदली है, पहले क्या सोचते थे, अभी क्या सोचते हैं, और इन सब मुद्दों को जो एफर्ट्स आपने किए हैं कम्युनिटी में, उसको आगे जाके आगे ले जाने के लिए आपको सीएससी की तरफ से क्या सपोर्ट चाहिए, हम आपसे अभी सुनना चाहते हैं।
मैम, सबको मेरा नमस्ते। मेरा नाम सुमन है और स्पेक्ट्रा आंगनवाड़ी कार्यकर्ता पद पे मैं काम करती हूँ। किशनगढ़ जिला अलवर राजस्थान की मैं रहने वाली हूँ। अभी जैसे हम बात करें कोविड-19 का दौर, तो कोविड-19 का दौर इतना मुश्किल था कि मैम बहुत ही मतलब हम सब लोग बहुत परेशान हो गए थे। हम समुदाय के साथ में जैसे हम काम करने जाते हैं, कैसे जाएं, मतलब रास्ते बंद, घर बंद, बाजार बंद, सब कुछ बंद था। तो उस समय बहुत मुश्किल आ गई थी, खाने पीने की व्यवस्था भी सामान की व्यवस्था भी नहीं हो पा रही थी। फिर कैसे हम लोगों से संपर्क करें, हमारे लिए बहुत मुश्किल हो गया था। हम सब आशा वर्कर कि जो महिलाओं के लिए, बच्चों के लिए और किशोरी बालिकाओं के हेल्थ के लिए हम उनके काम कर रहे हैं, तो हम कैसे करें। फिर हमने सोचा कि कैसे ना हम मतलब गांव के अंदर जाएं, तो हम गांव के अंदर जैसे जाते थे तो हम एक डंडी का हमने सहारा लिया, एक डंडी हाथ में ली और डंडी लेके हम गांव के अंदर गए, दरवाजा खटखटाया। दरवाजे खटखटाने के बाद में हमने उनसे बात की और उसी की दूरी हमने बना के रखी कि ताकि इस बीमारी से तो दूरी बना के ही बच सकते हैं। तो हमने दूरी बना के रखी, समुदाय के साथ में बात की और पता लगा कि वो बहुत ही मुश्किल है घरों के अंदर बंद, क्यों उस समय मतलब डिलीवरियां होने वाली थी, कैसे क्या करें, कैसे कहाँ जाएं, कुछ पता नहीं चल रहा था। तो हमने गांव के अंदर बात की, पंच, सरपंच और समुदाय के जो संपन्न जो परिवार थे उन लोगों से हम मिले। उसी दौरान स्पेक्ट्रा और सीएससी संस्था के द्वारा जो गांव के अंदर राशन जैसे दाल और आटा वितरित किया जा रहा था गरीब परिवारों को, और सरकार की तरफ से भी वो राशन उनको दिया जा रहा था कि भी वो अपना गुजारा कर सके कोविड-19 के दौरान। तो इसी तरह से फिर हमने भी बातचीत की, क्यों ना हम भी ऐसा कुछ करें कि संस्था वाले हमारे इतना कर रहे हैं, सरकार इतना कर रही है कि हम भी मतलब यही समुदाय में रह के और परिवार वालों के संपन्न परिवार के साथ मिलके राशन इकट्ठा करें, कुछ सेविंग इकट्ठी करें और अपने जो जरूरतमंद परिवार है उनकी हम मदद करें। तो इस तरीके से हमने आपस में सलाह की। जो हमारे एसएचजी चल रहे हैं उन एसएचजी की महिलाओं के साथ में हमने बात की, बच्चों के हेल्थ के लिए बात की। तो फिर हम सब इकट्ठे हुए और इकट्ठे हुए कि हमने अपना रास्ता निकाला, इकट्ठा करके जो जरूरतमंद परिवार थे उनको हमने वो राशन पहुंचाया। इसी बीच वैक्सीन का दौर आया। वैक्सीन के लिए हमने बोला तो सब लोग डर, मन में घबराहट, हम नहीं लगवाएं, तो बहुत मुश्किलें आई। हमने फिर वैक्सीन भी करवाया, जो पहले बुजुर्गों को करवाया, फिर उनको अभी जैसे बच्चों को हो रहा है तो बच्चों को वैक्सीन करवा रहे हैं। बच्चे स्कूल से छुट्टियां ले रहे हैं कि हम बच्चे स्कूल में वैक्सीन नहीं करवाएंगे। फिर हम डोर टू डोर गए और गांव के घर के अंदर जाके फिर हमने पूरी टीम ली, एएनएम दीदी और टीचर्स को हमने साथ लिया और उनका हम वैक्सीन करा रहे हैं। तो अभी हम जैसे संस्था सीएसी और स्पेक्ट्रा, उन्होंने हमें समय समय पर प्रशिक्षण भी दिया कि किस तरह से हम कोविड-19 से बचे। तो हम यही कह रहे हैं कि मैं यही कहना चाहूंगी कि जो संस्था की तरफ से हमारी जो प्रयास किया गया था, तो इस तरह के प्रशिक्षण एवं जो हमारा मार्गदर्शन है वो हमारा भविष्य में होता रहे, ताकि हम सक्षम बने रहें और गांव के अंदर ही रह के एक दूसरे का मदद करें। धन्यवाद।
बहुत शुक्रिया सुमन जी. And for those who do not understand Hindi, Suman ji was talking about the difficulties they experienced as ASHA workers in, conducting outreach with the people in the villages. They could not travel, there was no food, and they found it very difficult. They had to maintain social distancing, so they took a stick and banged on people's doors, literally to give them awareness and talk to them and build their confidence. So they have taken the effort to talk to the government leaders, the local panchayat leaders.
Puni, sorry, in the interest of time, if we can, we'd love to hear from all the champions here today. If we can move on to the next champion, that would be great.
Great. Okay.
Thank you so much.
Yeah. So our next. Jayachitra runs a culinary, a trans kitchen in Madurai. She has been associated with Sri Lakshmi Pengal Munnetra Sangam, and she has been empowering many trans women like her to lead better lives. Vanakkam Jayachitra.
Vanakkam.
உங்களை இந்த மேடையில வரவேற்கிறதுக்கு எனக்கு ரொம்ப சந்தோஷமா இருக்கு. ஸோ நாங்க என்ன கேட்க விரும்புறோம்னா, இப்போ இந்த கோவிட் சமயத்துல கம்யூனிட்டியில எந்த மாதிரியான சேலஞ்சஸை வந்து நீங்க பார்த்திருக்கீங்க, அதை வந்து தாண்டி வரத்துக்கு சிஎஸ்சில இருந்து எந்த மாதிரியான சப்போர்ட் உங்களுக்கு கிடைச்சது, அதனால என்ன மாறிச்சு, கம்யூனிட்டியில என்ன யோசிக்கிறாங்க, கோவிடுக்கு முன்னாடி என்ன யோசிச்சுட்டு இருந்தாங்க, இப்போ எப்படி அந்த திங்கிங் மாறி இருக்கு, நீங்க எடுத்த ஸ்டெப்ஸ், நீங்க எடுத்த முயற்சிகள்லாம் இன்னும் முன்னுக்கு கொண்டு போகணும்னா உங்களுக்கு சிஎஸ்சில இருந்து எந்த மாதிரியான சப்போர்ட் வேணும், அதை பத்தி கொஞ்சம் சொல்லுங்க.
வணக்கம், என் பேர் ஜெயசித்ரா. நான் வந்து மதுரை உலகநேரில இருக்கிறோம். என் கூட இப்போ ஒரு 15 பேர் இருக்கிறாங்க. நான் வந்து ஒரு சமையல் கலைஞர். அதாவது கேட்டரிங் வந்து ஒரு 10 இயர்ஸா நான் பண்ணிக்கிட்டு இருந்தேன். அந்த நல்லாவே போய்கிட்டு இருந்துச்சு. திடீர்னு 2 வருஷத்துக்கு முன்னாடி கோவிட் வர ஆரம்பிக்கவும் எங்களுடைய வாழ்க்கை நிலை வந்து அப்படியே மாறிடுச்சு. வேலை வாய்ப்பு இல்லை, வருமானம் இல்லை, எதுவுமே இல்லாத சூழ்நிலையில வந்து என்ன செய்யறதுன்னு தெரியாத சூழ்நிலையில வந்து சரி ஒரு தன்னம்பிக்கை மட்டும் இருந்துச்சு, நம்ம கையில சமையல் கலை இருக்கே, அதை வச்சு நம்ம ஏதாவது வாழ்ந்துக்கரலாம் அப்படின்னு நினைச்சிட்டு இருந்தோம். அப்பதான் வந்து ஸ்ரீ லட்சுமி பெண்கள் முன்னேற்ற சங்கம் அவங்ககிட்ட வந்து நாங்க போய் ஹெல்ப் கேட்டோம். அவங்கள வந்து ரொம்ப வருஷமாவே தெரியும். அதுக்கப்புறம் அவங்க மூலியமா தான் ஆர்கியம், அது மாதிரி விருத்தி, ஸ்வஸ்தி, இவங்க மூலமா ஒரு 6,50,000 ரூபாய் எங்களுக்கு வந்து ஃபண்டு கிடைச்சிச்சு. அதை வச்சு ஒரு சின்ன ஹோட்டல் ஆரம்பிச்சோம். ஹோட்டல் ஆரம்பிக்க போது வந்து இதுக்கு முன்னாடி வந்து நம்ம கேட்டரிங் பண்ணிட்டு இருந்தோம், அது வேற. இப்ப ஹோட்டல் ஆரம்பிக்க போறோமே, இதை மக்கள் ஏத்துப்பாங்களா, இல்ல வந்து ஒரு டிரான்ஜெண்டர் சமைக்கிறத வந்து மக்கள் சாப்பிடுவாங்களா, இல்ல நமக்கு ஏதாவது சப்போர்ட்டிவா இருப்பாங்களான்ற ஒரு பயம் மனசுக்குள்ள இருந்துச்சு. அது வந்து மதுரை கலெக்டர் வந்து திறந்து வச்சாரு. அப்புறம் மதுரையில் உள்ள ஜட்ஜ் அம்மா வந்து ஓபன் பண்ணி வச்சாங்க. நிறைய மீடியாக்கள் வந்து கவரேஜ் பண்ணாங்க. அதுக்கப்புறம் யூடியூப் சேனல்ஸ் நிறைய வந்தாங்க. நிறைய வந்து எங்களை வந்து நிறைய எடுத்துட்டு போய் நிறைய அது வந்து நாடு முழுவதும் ஸ்ப்ரெட் ஆச்சு. வெளிநாடுகள்ல இருந்து எங்களுக்கு நிறைய ஃபோன் கால்ஸ், லெட்டர்ஸ் எல்லாம் வந்து என்கரேஜ் பண்ணாங்க. ஃபர்ஸ்ட் வந்து லஞ்ச் மட்டும்தான் கொடுத்துட்டு இருந்தோம். அதுக்கப்புறம் 3 வேளை சாப்பாடு, காலையில நைட்டு எல்லாம் சேர்த்து மத்தியானம் நைட்டு 3 வேளை கொடுக்குற அளவுக்கு வந்து நாங்க வளர்ந்துட்டோம். இப்ப வந்து லேட்டஸ்டா வந்து இப்போ ஒரு டீ ஷாப், அப்புறம் வந்து ஸ்நாக்ஸ் இதெல்லாம் கொடுக்குறாப்புல இருக்கிறோம். நெக்ஸ்ட் இன்னொரு பிரான்ச் திறக்கிற லெவல்ல இருக்கிறோம். இன்னொரு பிரான்ச் திறக்கிறோம். எங்க மக்களுக்கு வந்து இதெல்லாம் பார்க்கையில நிறைய நம்பிக்கைகள் வந்துருச்சு. நிறைய தன்னார்வமா வந்து கேட்குறாங்க. அது மாதிரி எத்தனை கொரோனா வந்தாலும் எங்களுக்கு வந்து இதுல இருந்து சமாளிச்சு வெளியில வந்துடலாம் அப்படின்ற ஒரு சவாலா நாங்க ஏத்துட்டு இருக்கிறோம். இன்னும் வந்து பாண்டிச்சேரி, சென்னை இப்படி இடங்கள்ல எல்லாம் வந்து டிரான்ஸ் கிச்சன் ஓபன் பண்ணணும்னு சொல்லி கேட்டுட்டு இருக்காங்க. மதுரையிலயுமே நிறைய டீ ஷாப் இதெல்லாம் ஓபன் பண்ணணும் அப்படின்னு சொல்லி மக்கள் கேட்டுக்கிட்டு இருக்காங்க. நிறைய நம்பிக்கைகள் வந்திருக்கு. இந்த ஹெல்ப் எல்லாம் பண்ண வந்து விருத்தி, ஆர்கியம், ஸ்வஸ்தி, சிஎஸ்சி இந்த நிறுவனங்களுக்கெல்லாம் நான் ரொம்ப ரொம்ப நன்றி சொல்லிக்கிற விரும்புகிறேன். இன்னும் நிறைய சிஎஸ்சில இருந்து நிறைய ஹெல்ப்புகள் கொடுத்தா இன்னும் நல்லா இருக்கும். தேங்க்யூ.
Thank you, Jai Chitra. That was Jai Chitra for you talking about her thriving trans kitchen and scope for opening more branches across the country. We'll next hear from Ujjwala Patel ji. Ujjwala ji, namaskar. आपका इस मंच पे हार्दिक स्वागत है। और मैं ये चाहती हूँ कि आप बताएं कि फिशर फोक में कौन से चैलेंजेस हुए थे कोविड के समय पे, और उस वक्त जो सीएससी से सपोर्ट मिला उससे आपको क्या बेनिफिट्स मिले, क्या चेंजेस हुए हैं कम्युनिटी में, और इसको आगे ले जाने के लिए आपको क्या सपोर्ट की जरूरत है।
Okay. मैं उज्ज्वला पाटिल हूँ और मैं फिशर फोक जो ट्रेडिशनल फिशर्स है वो उनके लिए मैं मुंबई के 2 डिस्ट्रिक्ट से काम करती हूँ। मुंबई 2 डिस्ट्रिक्ट में कम से कम 41 विलेजेस है, बहुत बड़े लार्ज विलेजेस है, और विलेजेस में मुंबई ऑलरेडी डेंस सिटी होने की वजह से हमारे विलेजेस में तो एक घर में 2-2, 3-3 फैमिलीज रहते हैं। इस वजह से ये कोविड की जब परिस्थिति पैदा हुई 21 मार्च को अचानक से हमारी मिनिस्ट्री ने लॉकडाउन डिक्लेयर किया और मुंबई में ज्यादा वो फैल गया क्योंकि डेंस सिटी है मुंबई, और हमारे विलेजेस में भी बहुत ही डेंस सिटी होने की वजह से ये जल्दी फैल गया और इतनी घबराहट पैदा हुई लोगों में, हमारे ट्रेडिशनल फिशर्स के, कि उन्होंने अभी क्या करना है हमें। ये ऑर्गेनाइजेशन थ्रू हमें जब उनका मैसेज मिलते रहे तब हमने हमारे एक्सपर्टीज जो नेशनल कोस्टल जोन मैनेजमेंट से हमें जुड़ रहे थे, सर विवेकानंदन जी, उन्होंने हमें रुत्ती से फिश मार्क और रुत्ती रागिणी जी और बाला सर से मिलवाया और उनकी थ्रू हमने अभी हम इस कोविड महामारी से किस तरह से जूझ रहे हैं ये हमने उनके पास हमारी गुहार लगाई। तब उन्होंने हमें स्वस्ति थ्रू सीएसए थ्रू स्वस्ति से जोड़ा और स्वस्ति की वजह से हमारे यहाँ पे कोविड ही नहीं अदर जो डिजीज थे उससे लड़ रहे लोगों को कितनी मनोकामनाएं मनोभावना और उनको किस तरह से इसका सामना करे। उनका बीपी हाई होता था क्योंकि सबको वो समय पे कोई हॉस्पिटल खुला नहीं था, कोई कंसल्टेशन जो लोकल डिस्पेंसरीज थे वहां पे भी डॉक्टर नहीं थे। इस वजह से उनमें इतनी घबराहट पैदा हो गई थी कि वो अभी डॉक्टर नहीं, बड़े बड़े अस्पताल में किस तरह से जाए। वो टाइम पे सिर्फ कोविड पेशेंट ही एडमिट करते थे। वो टाइम पे स्वस्ति की वजह से स्वस्ति थ्रू हमें ऑनलाइन डॉक्टर कंसल्टेशन मिला। जो हमारे फिशिंग विलेजेस में जितने भी मरीज थे, ये अदर जो डायबिटीज हाई ब्लड प्रेशर के पेशेंट थे, उनको बहुत ही हौसला उनका बढ़ाया और डेथ कम होने का कारण वही बना। डॉक्टर सिर्फ वो टाइम पे हमें एक ही जरिया था, सिर्फ कोई राशन नहीं मिल रहा था, सब दुकानें बंद थी, वेजिटेबल नहीं, फिश तो नहीं और फिशिंग बैन भी, और महिलाओं का रोजगार भी बंद था। इसलिए अभी क्या आगे जाके खाने की नौबत आई, तब हमने रुत्ती थ्रू ये सब और ड्राई राशन का उनसे हमने बोला कि हमें ड्राई राशन की भी जरूरत है क्योंकि हमारे लोग रोज का कमा के रोज का खाने का ये फिशर को फोक कम्युनिटी है, ट्रेडिशनल फिशर्स है। तब रुत्ती ने बहुत सारी यानी 41 विलेज में 6000 राशन किट उन्होंने ड्राई राशन किट बांटे। ये राशन किट हर एक फैमिली की तरह के पास नहीं पहुंच सकता था वो टाइम पे, लेकिन राशन किट किस तरह से बांटा गया, एक घर को मिला तो दूसरे घर को किस तरह से आधा करके बांटने की हमारे लोगों ने कोशिश की। यानी कोविड आया तो कोविड ने बहुत कुछ सिखा के चला गया। कि आपस में किस तरह से हेल्प करना है, हमें एक सबका ख्याल कैसे रखना है, हेल्थ का ख्याल रखना है, खाने की चीजें बांट के खानी है। इस तरह से जो रुत्ती और स्वस्ति सीएसए ने जो हेल्प किया है इस फिशर folk कम्युनिटी को, उनमें जो आत्मविश्वास जगाया है, किस तरह से हमें महामारी से लड़ना है, आगे जाके ऐसी कोई बहुत बड़ा और भी कोई संकट आएगा, और भी महामारी आएगी, तो किस तरह से हमें आगे जाके लड़ना है, इसका हौसला उन्होंने बढ़ाया है। और अभी हमारी ये महिलाएं भी जो फिश वेंडिंग करती है, मुंबई में 60,000 महिलाएं फिश वेंडिंग पे अपना गुजारा करती है, उनको बहुत बड़ा हौसला मिला। सीएसए ने बहुत सारी मदद, रुत्ती की मदद से मैं आभारी हूँ सबकी, क्योंकि अभी जो कोविड की महामारी ने हमें बहुत कुछ सिखा के गई है, किस तरह से एक दूसरे को हम मदद करें, किस तरह से हम सबको हेल्प करें, ये सिखा के गया है। कोविड आया लेकिन कुछ लेके चला गया, हम में से बहुत सारे लोग, हमारे जो सहकारी मित्र थे वो भी चले गए, लेकिन उन्होंने हमें बहुत कुछ सिखा के भी गया, अच्छी बातें भी सिखाई है। हम रुत्ती की तरफ से सीएसए को बहुत बहुत आभार, मैं सीएसआर की बहुत आभार प्रकट करती हूँ। नमस्कार सबका।
Thank you, Ujjwala ji. Very nicely told about how telecare support, awareness, and access to ration kits, the community came together and helped each other. They've built their self-confidence and self-reliance. Very well said, Ujjwala ji. So we heard 3 women, 3 community leaders today, Suman, Jai, Chitra, and Ujjwala ji. They are 3 leaders, but they represent the many hundreds of leaders who are striving to build resilience among communities to enable them to bounce forward. I will leave you with one of my favorite lines. When you cast a stone in the water, it creates ripples. So through CAC, the ripples of impact are being felt across every corner of the country. I have been truly inspired by these leaders, and I hope you have been too. So on that thought, I will hand over the session back to Meghna. Over to you, Meghna.
Thank you. Thank you so much, Annapurni and the community champions, for being a true inspiration. And congratulations to all the CAC partners recognized in the COVID awareness category.
Partners have been the pillars of COVID Action Collab. You have shown tremendous commitment to the collaborative as well as your own communities. Our next segment focuses on experience and learnings of CAC partners. We take this opportunity to invite Vandana Nadig Nair, a serial entrepreneur and a dynamic elder care leader, to moderate this panel. Vandana, over to you.
Thank you so much. Delighted to be here, and a very warm welcome to all my panelists. Without any ado, let me first introduce all of them to you. Dr. Nering Daruwala, who represents Sneha Foundation and has done some remarkable work in terms of providing technical expertise and their social protection help desk. Varun Rangarajan, who's with Noura Healthcare, which has done great work during the pandemic in terms of education, awareness building. We have Mr. Parthasarthi, who represents Search, an organization which is doing a lot of deep grassroots work in Andhra Pradesh. And finally, we have Satya from FXB India Suraksha, who has done some remarkable work in Assam, again at the grassroots level from a vaccination perspective. Very different voices from the field, very different perspectives, different geographies. And we're looking forward today to listening to them, hearing their learnings, insights, perspectives. Welcome to all of you. My apologies. All right. To start with, I'd love for my panelists to unmute themselves, please. Thank you. So to start with, would be lovely to very quickly hear from each of you. Who do you serve, and a key achievement that you'd like to share with us about what your organization achieved during the pandemic? Varun, why don't you start?
Sure, thank you. Good morning, everybody. It's been lovely listening to all the segments before this. I'm Varun. I head the implementation function in Nura Health. So Nura Health is a public health organization. We serve families of patients in primarily in public healthcare facilities like district hospitals, community healthcare centers, primary healthcare centers, and so on. We're present in 6 states in India and 2 divisions in Bangladesh. One of the key achievements for us during the pandemic was really like partnering with many organizations and doing our bit to help them in reaching out to the public with, like you said, education and awareness about all the myths about COVID, like dispelling some of the myths, helping them understand about vaccines, about the best practices of social distancing, masking, and so on. Everything which we now take for granted, but back then was super new and unique and strange for everyone, right? So it was one of the key achievements, because since then we had worked largely with state governments and not really with other private organizations or NGOs and so on. But during the pandemic, we collaborated with more than 100 civil society organizations as well as governmental organizations, and provided them collateral in multimedia format like WhatsApp chatbots, audio, print, teletraining, IVRS, and so on. And we were able to scale up capacity to even like publish all these materials in close to 12 different Indian languages, and then provide them this support in a highly timely manner. And I would say that we also learned a lot in the process when working with these organizations. So it was a beautiful mutual exchange, I should say.
Thanks. Thank you so much, Varun. 100 partners. That is really, really inspiring. Wonderful. Thank you. Nereen, would love to hear from you.
Thank you, Vandana, and thank you, COVID Action Collaborative. I think our history goes a long way. We have been partners for a very long time. We essentially, Sneha, works in Mumbai in informal settlement, and you all know how Mumbai was on the forefront in COVID time. And because we have a large community outreach, I think our biggest concern at that point of time was how do we help the community? Communities who were, they had threadbare ration, they did not know what to do. In informal settlements, a huge problem was of social distancing because the houses are so close. How do you even manage social distancing in such an environment? So our concern at that point of time was how do we reach out? And we reached out in many ways. We also carried out a lot of COVID relief work in that time. And when it comes to the COVID Action Collaborative, I think it was the right time for them to enter, because it really, the collaborative helped us in 2 major areas. One was the social protection area, because when COVID happened, we had already started working on the public distribution system. But the COVID Action Collaborative support, we were actually able to establish a COVID relief help desk, a social protection help desk. And this desk, mainly the features were to provide information, to provide capacity building, and to see to it that people get access to rations. And we were able to serve about 50,000 people in our community. So that, and now systematically we have been able to kind of organize our social protection help desk project. Along with that, gender-based violence emerged as, especially gender-based violence is very broad, but we can say domestic violence and intimate partner violence emerged as one of the biggest. It was a shadow pandemic at that point of time. And with COVID Action Collaborative, we did a series of workshops with other NGOs, about 100 NGOs. And that again was very important because I think gender and gender-based violence really got the visibility at that point of time. And it helped us because we started a helpline and many organizations were able to reach out to us whenever there were women in crisis.
Thank you so much. Such an evolution, need-based evolution of your work during the pandemic. Incredible. Thank you. Partha, would love to hear from you.
Yeah. Good morning. Good morning to all, and thank you very much for giving an opportunity to have a discussion in the roundtable. Yeah, SETS being a grassroots level organization working with particularly with the small and marginal farmers and the fisher folk in the state of Andhra Pradesh, with having around 22 plus years of presence in the sector, implemented so many developmental projects with the support of the corporates and as well as the government institutions like NABARD. NABARD in promoting the vibrant institutions which can be help the farmers becoming as entrepreneurs. So in this working scenario, the organization has built a good rapport with the communities where we are working. So during the pandemic, actually, we started our own work with our own resources and the mobilized resources from the friends and the other people, individuals, some like-minded people. We started distributing ration kits, particularly in the urban slums at Guntur Municipal Corporation, where most of the communities are migrated to the urban areas for the daily wage labor works kind of thing. So that helped us very much in building the relationship with the district administration. That really worked in the next phase of our services, extending our services in relief as well as restoring the communities in the from the pandemic. So so this initial work and the joining as a member into the COVID Collab, COVID Action Collab, really we are very much wonderful to be part of the Collab, because Collab has played a, what I can say, it's a kind of a joint family kind of thing. So Collab has played a joint family role. Whatever the needs coming from the field level, from the communities and the organization level, so they responded very positively, and whatever the way they can support the organization to serve more efficient at the field level. So because in the beginning, everybody, the partners or the team doesn't have that much capacities on all the COVID action, COVID appropriate behaviors kind of thing, or the home isolation, or how to reach the communities kind of thing. There are a lot of confusion, and there are no clarity among the team itself. So to reach more effectively to the communities, we have received a lot of inputs from the COVID Action Collab through different platforms, through different webinars, through different regular meetings that help us to reach more effectively to the communities. Later on, SETS has been able to serve more than 88,000 the vulnerable people through the Vaccine Now program with the support of Vihara. That's only possible because of the back end. We have a COVID Action Collab. So otherwise, we would not be able to reach that much number in a short period. So really, we reached these people within a short span of 3-4 months in an urban environment, urban vulnerable community case. That's only possible because of the COVID Action Collab is there behind us. We would like to see Collab.
I'd like to move on. Partha, I'll come back about where you want to go, where you want the Collab to go. We'll come back to that question a little bit later. If I can get Satya to share some initial thoughts. Satya.
Thank you, Vandana. And
it's been heartening that, we are coming back and reflecting on the way this journey has been. This is an incredible experience for us. This is not something new as an organization I would be bringing on platform, because everyone has experienced the same journey, starting from phase 1 to phase 2, and the way we try to, recover and prepare ourselves for phase 3. Now, the journey FXP works with 13 states of India, and in the initial phase, we started working based on our existing resources and the need which the community is actually looking for. Now, the two things which are very critical and vital to bring on. First, the way the government, obviously for the first time realized the strength of the civil society in this space, where they created an ecosystem where the district administration is there to facilitate the civil society organization. And that was the first opportunity we gauged, and we become the nodal organization with the district administration in rolling out and coordinating with the other agencies on COVID relief and related activities. Because everybody was trying their best to mobilize resources, but what was happening, the impact was not happening at scale. So at the first phase, we were working almost in silos. We were definitely developing proposals, reaching out to resource agencies, we were mobilizing resources, but that was very limited. We were able to reach out to 1-2 states. But, and the best part, I don't know how CSE got to know about us. We didn't approach, so this journey was very new. This partnership is very new, but it was incredible to us. The first journey we started with Pondicherry. Pondicherry, everybody would realize that being a tourist hotspot, you may not require those kind of resources or those kind of strength which CSE probably is going to bring on platform. Now, that was the journey we started. It was amazing. We started engaging with the state government. The state government was really looking for such kind of technical expertise. The best part, CSE, let's say what they did in Bangalore, what worked in Bangalore, they wanted to replicate to the other states, and that learning actually helped us to adopt in a very quick time, and that actually also helped the government to draw that kind of strength, connect that, okay, this partner is actually going to bring something for the community. To be very honest, till the first 2 phases, we were able to reach out to almost 3 and 3.5 lakh community people directly, through the different means. If you look at the softer messages, if you look at the vaccination mobilization, the COVID behavior, even mobilizing resources for the state government. Now, moving forward, we also realized that, this pattern has to go. At the same time, we need to replicate and take it to the areas which has been not reached out by several organizations, such as Northeast, and FXP has that kind of strength of working for more than a decade in the Northeast in different issues, including trafficking and other areas. They developed this partnership with the CII, and we are so glad that, you honor the strength of the partnership. So CSE, worked as a perfect bridge where FXP and CII currently implementing program in Assam. They were highly impressed. And now they have extended it to Manipur as well. These are the areas which are far-flung. If you're aware of the topography, it's not easy even for the government agency to reach out. So it's been an amazing journey. Thank you, CSE, for trusting and believing in us. It's going to be a great journey. And this is one of the best learning probably we can have to showcase that, maybe in future you will have a similar situation in a different phase. How do you prepare this resilience? How do you draw upon each other's strength? And I think I don't see that I have experienced a better platform and a partnership like this. Thank you, Vandana.
Yeah. Thank you so much. Such heartwarming introductions to your organizations and the incredible work that you've done. We often, typically, and I fell prey to the same thing, right? My first question to you is, what were your achievements, right? We love to talk about those, and those are great, and it's important that we celebrate those. But I think it's equally important that we step back, reflect on what we could have done differently, better, more of, less of. What was some mistakes, failures, learning opportunities maybe for us that now in hindsight, which we always say is perfect, you look back and you say, I wish I'd done that differently. For example, and I'm happy to share first, I'll definitely say that at Elderate, we did not reach out for help to other people. We were just scrambling like headless chicken during the first wave. In the first week, we got over 600 phone calls. In the first 6 weeks, we reached out to over 700 elders across Bangalore, but we were a team of maybe 15 of us doing it. So it was demented. In hindsight, I wish we had taken the time to breathe, step back, and reach out to more people, like, for example, the riders, the cycle group that was so active around Bangalore, for instance, right? So that was, for example, I think a learning for me in hindsight. So would love to hear, what would you have done differently if you could redo it again? One key thing that you'd like to maybe change or do differently the next time? Neri.
I think what we would have liked to do differently, and I'm referring to the gender piece. Gender and gender-based violence are not concepts that are usually accepted. So, an NGO who's working on so many health issues, even the need was spelled out by many NGOs that they wanted to work on GBV. But in actuality, I think what could have been done better was, instead of running a series of workshops, we could have probably done smaller groups, taken smaller groups and actually formulated a strategy. Very basic formatted work to do. I think that is what would have helped organizations more. But I also, when I reflect, Vandana, that wasn't the right time, because as a COVID Action Collaborative, they were also trying to deal with so many issues. So it's easier said than done that we could have done this. But maybe it has its own time, and now when I reflect, we could do it over a period of time.
Well said, well said. Thank you. Satya?
I don't know. I was just thinking, how to respond it appropriately. See, this time, it was a all new experience. Even we were present in the sector for almost several decades. And the only experience we had to draw was from Ebola, and since I passionately work on child protection and other, I'm great that Nareen is bringing the issue of gender-based violence. Whatever strength we had, we started working on it. And the CAC, what you brought about the learning of the other organization, because one thing which everybody will appreciate, that we built newer partnership. We got to know what is the new ideas or knowledge other organization is bringing on the platform. And the best part during this time, that I don't see that there was a sense of insecurity, See, ideally in the development sector, you would like to preserve for your own, and that could be your USP. But this was a time where everybody was open to share, and this art of giving was totally acceptable, and we wanted to, the idea that how do you reach at a scale, because we have limited resources, mobility was restricted, whosoever is in whatever area, we wanted to reach out. Now, going back, straight away to your question, Vandana, it's very difficult to say and comment on that, because whatever CSE as a team has brought was amazing, because they were able to reach out at a scale, somewhere the way, let's say, Niti Aayog wanted to do that, draw on all the organizations who are listed with Darpan, share whatever new ideas which is being executed by the partners, they were sharing through their emails. Now, the thing that how do you really tap on the area which is not easily accessible to reach out, such as Northeast. If you look at it, and that's what we were initially struggling, we were trying to reach out to the agencies, but they were not able to draw upon that. Will you have the strength to reach out? Second, if you look at the cost of implementation is little high because of the topography and the travel cost. So somebody who's not familiar with that reason, they will find it difficult that, oh, is that going to be your business model? So thirdly, is about the cross-cutting issues. Having said that, we started working more on the medical front. But what Nareen was saying, the issue around the child protection, gender-based violence, and I know CSE as a collaborative is bringing that strength on platform. And I know we started having a discussion about how do you build on resilience, which I'm sure we'll be talking about it very soon. But I think the way, the scale was there, the engagement with the government agencies were there, but most probably, how do you really translate into, at scale? Because we were trying to reach out to state government, and we were really persuading and telling them that, see, this is the strength if you talk about the social protection, etc. So I think that is one of the area we should be really looking at.
Sure. And I think that is that's truly the challenge of scale, right? Because when you're trying to do something at scale, you need to almost be singular in your focus to get it done. But the truth is that there are some perils of that approach, because there are ancillary associated issues that may not get the addressal maybe that they need. So, very, very relevant point.
And Vandana, once you are in the community, you develop that kind of confidence and reliability that, okay, you are the one who will be bringing everything, which is not possible.
Yes,
so,
yes. Very well said. Very well said. Partha, how was your experience? Anything that you think you should have done differently as such?
In the initial phases of collaborative this thing, we didn't feel that we have a strong support. We will receive a strong support or whatever the requirement we can receive from the collaborative. We don't have that much confidence. But later on, looks the positive response from the collaborative is very whatever we required, they are ready to support. So if we have that much confidence on the collaborative, definitely we would do in a different way at the village level, because in the rural, particularly in the fisher folk communities, most of the people feared and gone to the hospitals and spent a lot of money on the asymptomatic issues, asymptomatic things also. So that would have been stopped and saved a lot of money at the field level, at the grassroots level, if we have that much support we receive from the collaborative thing. So there was a lot of confusion among the communities on the asymptomatic things and the actual cases kind of thing. So they hurried and went into the lot of hospitals and joined and spent a lot of money on the that would have been stopped if we would have get the initial phase of confidence.
And like Nareen, I think was saying, we were all learning. We were all sort of, our bullet train had left the station, and we were laying the tracks dementedly as we were, learning and doing and so on. Varun, have any key learning from Noura's perspective, things that you would do differently?
Sure. I don't know what we could have done differently. That's something which we revisit once in a while and keep thinking about. But we constantly try to get better feedback loops from the organizations that we worked with, because we had a set of products, right? Like we built some technology products, IVRS, chatbots. We also did a lot of design, and we try to, and our organization's core is also behavior change, communication, design thinking, and so on. So we constantly try to keep the communities in mind in the center of all our designs, and to see and to empathize with them deeply and make content which really will appeal to them, and help them rethink their behavior patterns and so on, right? So if we were able to create some better feedback loops from the organizations as to what is working, what is not working, in terms of like some testimonials or some narratives around, hey, this is what we learned from your training, but when we did this, like this was the expected behavior, but something else happened. And if we could have gathered some patterns around those, that would have helped us to relook into the program design once in a while and make and constantly tweak it so that we are adhering to the changing realities in the field. So that is something which I don't know how we could do it better. We tried a lot, and we did get some good inputs as well. But that is something which we will constantly keep working on as an organization itself, and especially in such programs for sure.
Lovely, lovely. Thank you all so much. I think to end, I'm going to do a quick rapid fire. Yeah. So my first question: how many CAC partners have you worked with, Nerine?
We have worked about 80 partners, CAC partners.
Satya?
I'm blank, but at least 5.
Okay, thanks. Partha?
Yeah, we are working with 6 partners.
Varun?
76.
Fantastic. My second question to you. After vaccination, so you need to complete this sentence. After vaccination, the focus should be dash.
Recovery of, I would say recovery of their income, which is a very big issue with community.
Okay, Satya.
Building resilience and maintaining COVID positive behaviors.
Okay, Partha?
What is
next focus after vaccination?
Yeah, we should rebuild the communities. So there were a lot of losses among the communities in the families. We should focus on the rebuilding the communities.
Thank you. Varun?
Some of these practices which we have started adopting now, healthy behaviors, we should try to make that the new norm going forward as well, with or without COVID.
Okay. Third question. If you had to reimagine the CAC network, one thing in your wish list, one thing that you wish for CAC to do, become, evolve into going forward. Anybody?
So even to the listener, these rapid fire questions were not shared with us in advance. So pardon our silence. I mean, certainly, there should be more communication because we were not able to meet, frequently like today we are meeting, and you draw upon each other's strength. Certainly CAC was one of the mouthpiece who was sharing this, but this gives you a different feel that, look at, you are not alone in the field, this is the power. Yeah.
So more meetings and getting together. Lovely. I like that. Nerine?
I would say the same thing. I mean, much more planned and focused work, because the CAC outreach is just amazing. And also, I think the way they have been diligent in following up with the partners, it's really something very credible, and we can continue doing that.
Nice, well said. Thank you. Partha?
Yeah, that's what I said. So being in a joint family, so elders always take care of their family members by assessing their weaknesses and strengths, and assessing their capacities and their capabilities. So the role which CAC is playing, it's really very helpful to the community, helpful to the organizations like Search to scale up more into the new areas or reach more communities, particularly vulnerable communities. So I wish this kind of role will continue further to rebuild our communities who lost all livelihoods, lives during the pandemic. So this should be our focus. Should be more on the building the communities.
Thank you.
That's what I want.
Thank you. Varun?
Would love it if you guys can help us all with providing better feedback systems and more instant feedback systems and processes. So that would help us tweak our programs, like I said earlier, to the ever-changing realities on the ground.
Excellent, thank you. And this is literally my last question. Will masks come off this year, yes or no?
I mean,
Maybe
staying in
no.
Delhi and the big A cities, this should be the practice. We started even before the COVID, but as I said, this norm should continue.
Okay. Yes or no, Partha? Masks, this year, will it come off? Mute.
Hope so.
Hope so.
Yeah.
Okay. Varun?
Yes. Yeah.
If you're asking will, then yes. If you're asking should, I would say no.
Fantastic. Okay. Well, thank you so much. This has been absolutely fun, and sorry to have, I did forewarn you, I may do something like this, but thank you so much. You've been a wonderful panel. Thank you, Kak. Looking forward to the rest of the sessions.
Thank you, Vandana.
Thank you, Vandana. Thank you.
Thank you.
Thank you, Vandana, and all the panelists who are part of the discussion. Really insightful. This panel has truly been found food for thought.
Oh, yeah.
Thank you, Vandana, for
You're on mute.
Thank you, Vandana, and all the panelists. Really exciting, the rapid fire. And congratulations to all the partners recognized for your persistent and timely action. We take this opportunity to showcase one of our key partners, that is Voluntary Health Association of Tripura, a 33-year-old social development organization that has been creating excellence in health and socio-economic development for the underprivileged across Tripura and 2 districts of Assam. It's a privilege to invite Dr. Srilekha Ray from PHA, a homeopathy doctor and well-known social activist of Northeastern region of India. She played a key role in establishing a helpline for children in Northeastern region and has trained more than 10,000 health workers in Tripura. Dr. Srilekha, over to you.
Yes. Thank you for inviting my organization and me for this wonderful session. Voluntary Health Association of Tripura, it started its activity in the year 1988 and with the vision to create excellence in health and socio-economic development with priority to the less privileged section of the society. Next, can I go to the next slide? Am I audible? After all, am I audible?
Yes, you're audible.
Our experience in collaborating with the CSC. So we started working with CSC with the COVID appropriate or promotion of COVID appropriate behavior and social protection. The block premises and support people to various social issues and promote COVID vaccination. We distributed dry ration kit to 200 COVID affected poor families. And now the vaccinated in West Tripura, South Tripura, in Sepaijala and Gomati district for 1 lakh people of Tripura. The collaboration with the local government authorities in a very strategic technique and time-based implementation procedure. We promote vaccination demand as per the local situation. We organize regular monitoring of vaccination at PSC level and getting regular guidance from the CSC. I like to specially mention regarding the guidance we received from CSC. It was incredible guidance, which helped us a lot for implementing our activities. Next slide. We felt that if there was a scope for mass awareness activities in these activities, consultation with PRI members and local leaders is very important. Promotion of door-to-door vaccination in some areas, especially, you know, Tripura is a hilly state, and we have remote hilly terrains where if it is possible to do the door-to-door vaccination, it would have been better. And the organizing vaccination camp in less accessible areas. And our expectations from CSC, we expect for strengthening public health infrastructure, health awareness, health camps, training and capacity building for livelihood development, advocacy on public issues for PRI members and community leaders, livelihood enhancement for the needy people, and especially the mental health establishment, mental health, which we call psychosocial support, which is very much necessary, especially for the post-COVID situation. Youth-based promotional activities and career development interventions, legal advocacy, counseling for awareness, and women empowerment. This is our expectation from the CSC. We are a small organization working in a small state. We are always very much eager to learn, and we have learned a lot from working with the CSC. Every day we are learning, and we could strongly feel, though we are a networking organization, we could strongly feel that the strength of the network. That is one of the best learning for us. That's all.
Thank you. Thank you so much, Dr. Srilekha, for your thoughtful action during this humanitarian crisis and for all your advice on how we can improve our support to communities moving forward. Well taken. And congratulations to all the partners recognized for your efforts thus far. In the next segment, now, in the words of Eleanor Roosevelt, the future belongs to those who believe in the beauty of their dreams. And on this note, to moderate a panel of esteemed guests on what the future of CSC could hold, we would like to invite a dear friend, philosopher, and guide to the COVID Action Collab session now, Arvind Kumar. Arvind has been instrumental in steering the partnership between USAID and CMS. Arvind, thank you so much for being with us every step of the way. We invite you to take over along with our panelists, Hari Krishna, Governing Council member and UNDP, Shri Sinha from the Children's Investment Fund Foundation, Puneet Agarwal, Crypto Relief Foundation, Gayatri Vasudevan, Chairperson LaborNet, and Shiv Kumar, CAC. Over to you, Arvind.
Thank you, Meghna. This is super impressive. What a way to celebrate our milestone of achieving 10 million. I'm truly impressed and very delighted to be a part of this important collaborative. I know that we have a short time frame, so we have eminent speakers. Since morning, we have heard a lot about the collaborative's activities, achievements, and partnerships with various stakeholders. So for the next probably 20 minutes, we are going to discuss with the key eminent speakers here, panel members here, who are associated with the collaborative, to understand a few things. How they manage to keep the interest of such a large number of partners and leverage their full potential. What were the critical factors that facilitated in some of the big achievements? What needs to be done more? And I know that in a couple of the earlier panels also, we covered some of these points. And how can these initiatives be sustained for broader system strengthening and resilience building efforts? So maybe let me start with Gayatri first. Gayatri, according to you, what are the one or two important support areas that the collaborative has provided to partnering organizations to achieve their optimal potential for achieving COVID outcomes as well as strengthening resilience efforts?
So I would say, first, thank you so much for inviting me into this panel, Arvind. I would say the thought leadership would be my first, if I could say bat 100, that would be my score there, because the way I look at it is the CSCs is a group of people who come together to where you're able to share experiences but find solutions. I think the sort of impact canvas methodology is very, very useful for most of us. I would say that is where is the maximum strength in it. The second place where I would again would like to call out is, I believe in the social sector, we often don't think there is a wrong way of putting it, but Narad Muni required. You need to sort of coordinate things. We underestimate the need for it. And the reason is we're all in competition with each other. The funds are scarce, you're in competition. But this is one place where I have found that the willingness to actually look at it from a different perspective is very high. And maybe it comes from that collaborative thought process itself. So these would be my two main points. For us personally at LaborNet, as well as in every meeting, we do try to participate in as many as we can. I do see that that's the win-win formula.
Thanks. That's very, very well put, Gayatri, particularly the thought leadership, the creativities, and just going beyond the personal or individual projects or organizations' interest to make it much more collaborative so that it's a shared vision and everybody benefits from this particular collaborator. Shiv, my next question is to you. You have a very interesting designation as Chief Integrator of the Collaborator. Tell us a bit more about your role as Chief Integrator, and also, according to you, what are the broad themes or activities that the collaborative should continue to focus? What should be transitioned? And what should the collaborative focus more in the coming days? Actually, it's two questions. Sorry to load it up. Shiv, you're in mute.
Can you hear me now?
Yes.
I would have preferred Chief Servant, but Chief Integrator is a designation my co-founder and confounder to me, Raghu, has given for me. So I think there is one of the things about collaboratives is that there is a need for different kinds of integration, right? Our teams, how they function. We have a partnership results team, we have a value delivery team, we have a thematic domain teams. All of them need to be integrated at a certain level. And the integration really is a value for partner and results for the communities. Right? And that's something which is, we all say it, but quite difficult to achieve. Second kind of integration is really the donors' requirements and our partner requirements. Again, all of us say we work on COVID, but then when you get to the nitty-gritties, Arvind, there are tremendous differences in the way we are looking at things, right? That's why we have to slice and dice the issues, the geographies, the partner, the types of community, and then marry these together. And that was another integration role I had to perform, not all by myself, with the team. We had to do it together. And a third kind of integration is really the community needs and what the partners can and cannot do, right? And during COVID, LaborNet is an example, right? From skill building, Gayatri and team had to very quickly pivot to even providing health services, not only health services, but health workers. In doing so, how do we help our partners in doing it? Not all partners we have been able to help in that. So that's another type of integration that I have been very busy with. And as I mentioned, partly I would say it's work in progress. I would say to your question on what do we continue doing, I think there are some innovations we have proven which we should continue. The sewage testing, the pandemic plastic, telecare are examples. I also feel, Arvind, that this is a great opportunity to bounce forward, right? And therefore building the health systems out of this crisis, right? In terms of district level interventions, living equipment, Green Health Alliance. I think the future lies in really strengthening the system. When we come out of this, I think we should come out stronger from here. And our dream is also to transition to being a community action collaborator, which is ready for the future kind of a pandemics and climate related challenges. We have Hari here, who's a big expert on natural disaster management. And that is our aim, to be ready for the next time. We don't need to mobilize every time like this.
Wonderful, wonderful. I think you very well articulated about the integration part and the role as an integrator. Not only you, but your entire organization and team is working towards bringing the alignment of donors, the community networks, as well as the priorities of the various field level issues. Also, thanks for articulating and giving us a sort of a heads up on how you're visioning from a COVID action collaborative to a community action collaborator. My next question is to Hari and Shirish. Hari and Shirish, you both have been serving as advisors to the collaborative and have brought in immense value to the program. There's definitely a lot of good work done by the collaborative during the 3 waves of COVID, particularly with regard to the vulnerable population. According to you, how do you think such a collaborative can sustain and leverage the collaborative for particularly system strengthening and resilience efforts? Maybe Hari, you can start.
Yes, okay. Thank you, Arvind, for having me in this panel and for this wonderful question, which is very close to my heart. And 2 things that I pick up from Gayatri and Shiv. Gayatri said the thought leadership. And thought leadership is what CAC has provided, and Shiv Kumar's designation as Chief Integrator. I think we are hearing first time, and it is very well thought out designation, because integration is what we need. And I say these 2 things, and I add one more, is that action advancement. Thought leadership, integration, and action advancement. These are the 3 pillars with which CAC has been defined, and it is these 3 pillars that CAC is very robust and we should look forward also. And if I add the 4th pillar to this, of course we cannot stand on 3 pillars, so the 4th pillar to this is communication. The problem is that I say communication because we are living in silos, and there is a need for integrating more and more people from diverse fields, because everybody has a potential and everybody has an intention to contribute to overall societal development. So communication is key, and we need to enhance. We are excellent in communication from creativity and outreach side, but we also need to make sure that it reaches as many number of people as possible. Now, coming back to the key question in terms of how do we link with other trends that we have? So if you look at the world, COVID is our obsession over the last 2 years, but the world continued to suffering from various other issues like climate change, poverty, inequality, gender inequalities, and also most importantly, increasing range of humanitarian crisis situations in many parts of the world. So in this situation, CAC, and also these things are happening at a geopolitical context that we have today. That geopolitical context is crippling the potential and the capacity of many donors to contribute and many agencies to support the way they have been supporting for the last many decades in developing countries. It is in this situation, CAC is perfectly positioned with what we call what we are calling for in the humanitarian world, localized humanitarian action. And the localized humanitarian action that we have been talking about, but the CAC provides a robust example of how localized humanitarian action can take forward. As Shiv mentioned in his presentation, 75 to close to 75% of the funds that CSA has raised from the government of India have come from the government of India through a number of schemes. And this is where we largely fail and look forward to other countries and other donors whose capacity, whose intention is diminishing day by day. As you can see, ODA funds are declining and non-traditional donors funds are also declining rapidly. And every country has resources within and source those resources within. And CSA is perfectly positioned for that. We have seen number of networking organization, coordination organization, but CSA is one unique example where it provides example of how this coordination and networking should work.
Hari, can I pause you for a minute there? I just wanted to take a little bit more insights on that particular point which you are speaking about, localized humanitarian action. Yes, you're right, absolutely right that we need to focus on broader societal issues, and collaborative is well placed, as well as the diminishing funds that are coming, resources that are coming from the sources. So if just to take a minute on that point, how do you think CAC should position itself in terms of, they've done some work, but if it has to be a much more strategic and taken at a larger scale, what would be your 1 or 2 recommendations for that localized community humanitarian action programs that they could undertake?
Oh, yes. I think that CSE has 3 areas, especially in the localized action. One most important is harnessing local capacities. Okay, local community-based organizations, formal and non-formal organizations. Like non-formal means when we say non-formal, like youth clubs, residential associations, and this kind of stuff. And the CBOs, as we know, there's a large number of them, and helping their capacities with preparedness. I think we have been responding ad hoc manner to different crises, and now the world is becoming increasingly uncertain with a number of situations, crises that coming up. The civil society organizations, formal and non-formal capacities have to be strengthened on preparedness point for number of crisis situations that they have to respond to. That's number 1. Number 2, preparing these community-based organizations with robust accountability mechanisms so that they are trustable and reliable for channeling resources directly to the people who are in need, so that the intermediaries' role can be largely diminished. I think this is substantially CAC is already, but on this we can strengthen our role. And the most importantly, third role is that strengthening the leadership at various levels, especially focusing on youth and women. Leadership of youth and women in taking lead for humanitarian response, especially in a scenario where a lot of activism is remained in the smartphones, and bringing people out from the smartphone to the streets is largely reduced. I think this is where, in order to harness the potential of willing youth and willing women and girls in providing leadership with all that potential that they can bring in, I think these are the 3 areas of localization I think we should bring in, and it is indispensable. Localization is indispensable, and CS is perfectly positioned for that.
Wonderful, wonderful. Thanks a lot, Hari. I think the points that you mentioned about from an ad hoc to a more systematic response, accountability and leadership of youth and women are definitely important points. Shirish, over to you. I know that if you want me to repeat the question, but how can this collaborative, which supported more as an emergency, move to a more structured, sustainable system strengthening as well as resilience building program?
Thank you, Arvind. And let me first start by saying, thanking the CSC especially, and also the Catalyst team for giving this opportunity and having me here, but also for, what an excellent response this has been by bringing together different, and as we said, the role that Shiv plays of an integrator, bringing everyone together, and touching lives of millions of people, right? And I think, and we heard stories about how it has made change in the previous session. So I think that's really been an incredible journey for 1 year. And in the role that I play within the CAC, I have seen in the last 7-8 months the kind of programs that we are investing in and kind of programs that we are bringing change. Even the largest initiative of the Vax Now, we've reached hardest of the regions where the existing infrastructure itself was unable to reach, right? Through the partners and which Hari was talking about, civil society organizations and community-based organizations, which are very difficult to reach, but to build that capacities to deliver has been quite. But I agree with to look forward, and as Shiv formulated, in terms of thinking forward or bouncing forward, I believe that's going to be extremely critical now, especially as we hope that we are coming out of this wave of the pandemic. And I think we need to kind of move beyond, the fact that we were focusing on emphasis on relief so that people could survive and thrive. Now is a time that we want to invest in or direct the CSC focus, while continue to maintain what is needed for survive and thrive, but at the same time, start looking at how we can build resilience in communities, and also by building on those infrastructure or the ecosystem that is required to sustain, right? And as Shiv and Hari were basically mentioned, I think we do know that this is an opportunity for us to think of how we can be better prepared for any future catastrophic events, right? And I think that this is the learning and lessons that we should learn from last 2 years. Yes, there was we were not fully prepared. Nobody anticipated also of the nature of this. And so we need to make sure when we say resilience, can that future development architecture or the institutions and opportunities that needs to be there, can it be made less fragile? And how we can basically make it more diverse, inclusive. And that is what I would frame it as resilience, right? If it is less fragile, therefore it is able to bounce back much faster, right? Now, when Shiv and Hari were mentioning, they talked about climate change, and I work in that particular space, so I know some of the things that was immediately focused in that was around green recovery. And what everybody talked about in green recovery was to look at anything which was a shovel-ready projects that could immediately be deployed, right? And therefore, immediate focus came on increasing renewable energy, increasing energy efficiency related projects. But I think what needs to be done, and that's what our experience shows, is that we need to start very significantly investing in the long-term solutions, which can build resilience to climate impacts. And in a sense, some of the impact can be seen of the losses of the biodiversity losses, etc. That's also been playing a critical role. So we need to also start investing to build longer term resiliences to more nature-based solutions. So I think that's something that we think is going to be important. And as I've always believed that solutions are existing.
Just a quick question on, and again I'm just playing the devil's advocate here. The CAC has been, CAC and the collaborative has very strongly focused on health programs and working with community, working with the local government. So they have a lot of strengths from that angle. Now, I'm sure that while climate change and green health are critical, would it dilute a little bit of the focus? Because they are very, of course, climate change and health are definitely directly connected. But do you think that you should be specialized in a couple of areas, or do you want to sort of broaden your scope because there's a good network you have, the community actions, community networks in the ground, as well as local stakeholders and private sector? This is for you, Shrish, as well as for the entire panel members. What do you think about that? Should we be more focused on areas where the collaborative has done well, or do we take on the expanded role of broader societal challenges? What is the balance and mix that such a collaborative should consider?
A very quick response, Arvind, on this is that while yes, we have a very good effort that has led to focus on health and building on that infrastructure around that, I think that provides us the platform to very carefully expand into areas which will make communities become much more resilient. So therefore, that's why I was basically saying, linking this to the nature-based solutions, which will which are essentially critical, right? You can diversify your livelihoods and opportunities around that, linking to that, right? And I think that could be an area. So I'm not saying, I would say go in future in all areas and all sectors, but be extremely selective where the linkages are much more strong. Let me pause here.
Perfect. Gayatri, any thoughts from your side on that? How should the collaborative focus the next sort of programs? Should it be strengthening, building on what they have done well, or taking on more and more areas, which is important for the society?
I think strengthening, I would say first there. But having said that, I think there is a lot of interconnectedness, and Shiv sort of said it in our case as an organization, and I would say extend it to the collaborative a little bit, I think what the COVID showed us is that we were working in silos. Just as much as government talks of convergence and is absolutely failed to do any kind of convergence, they struggle with it, right? And all of us are aware of it. In a similar manner, I think it's very difficult to separate. And therefore, one needs to look at, and the shocks which are coming, economic shocks, which are going to have impact on health, is very large. And health impact is the one reason for actually, livelihoods, savings, future plans, etc., go awry. And especially in a very, the world has transformed. So you're going to see careers change every 5 to 6 years, not even a decade. It's going to be that short, which means that sectoral change because of the labor market, environmental changes which are going to change the way in which we can operate and live, means we don't have actually the luxury to walk away from it. So I do believe that while the pivot could be on health, there is a requirement for the adjacencies to be catered to, and the partners of CAC that have put together, I think today are there and possibly can build on. Therefore, attention may not be possible only on healthcare.
Perfect. Thanks, Gayatri. Shiv and Hari, you want to step in and give your thoughts?
I'll give way to Hari first, and then I'll come in.
Okay, Shiv, thank you. I think this is not my final thought, but I'm still learning on this, on CAC's future. What I think is that COVID action and collab are key. COVID is contextual. And the CAC brings, as I said before, it establishes a model of building resilient systems. And if you look at the members of CAC, 350 odd organizations, they all have different areas of focus. And they all have, some of them may be specialized in health, some of them something else. But they all have come together to respond to the contextual need of COVID. There will be many such contexts emerging. So CAC does not have to lose its focus, rather it has to build tools, preparedness tools, response tools, and advancement tools that different partner organizations can use for responding to different situations.
Well said, Hari. I just want to build on what Hari said and also remind us that COVID Action Collaborative's main focus is vulnerable communities. It's not sectors, it's not issues, it's not diseases, it's not virus, right? And I think one of the early statements we made from CAC was that from a virus-centric reaction to a people-centered response. And I believe that health or education or livelihoods or climate change are issues which affect the vulnerable communities the most. And what I also believe, with a great deal of humility I say it, is that COVID had a fairly strong health issue, but I think the adjacents, what Gayatri is referring to, the social protection, the livelihoods, we have already started work on that, right? And I don't think it's not an organization in that sense. There are organizations within the collaborative which can continue to focus on health if they have a health focus. But I believe CAC can also expand and take advantage of the enormous capacities in the country. And I believe India has tremendous capacities on the ground. Shirish, we've been lucky working with some of the climate change NGOs and entities, just tremendous learning, the commitment, and it's the same thing. They may not be community-based organizations, but they are climate activists doing tremendous work. I think CAC should reach out and work on climate change as well as livelihoods as we get out of this pandemic. And therefore, I see the intersection of health, livelihood, and climate change is the future of CAC. And I don't think it will derail us. And as Hari put it, we need to build on the packages, build on all the replicable ways in which we collaborated. Because the collaboration science and what we call as Alliance Sutra itself is very new. And I think COVID has provided a great leveling field where we all learned we need to collaborate, right? And despite all the competitions, let's come together. I would say we should build on it and not just be sectorally focused, but be truly focused on the people.
Awesome. I think that's been a great discussion on the future of areas that the collaborative could consider. I'm not sure if Puneet is able to join us. I don't see him in the screen, but let me put a question to the panelists. My final question is all about the engagement of the private sector. We know that the private sector has phenomenally contributed in the last 2 years when it comes to the COVID action for the COVID programs. Probably it was an emergency. Probably they had every one of their friends, family members, employees, supply chain people impacted. So there was a urge and need for them to even immediately contribute. Also, the results were easy for them to be sort of witnessing. Like, for example, an investment of so much could bed the ICU bed capacity strengthened, or vaccines being provided to vulnerable populations. So my question here is that how can we, what type of systems should we consider for engaging the private sector or leveraging the private sector investments on a more longish term, where you may not be able to clearly articulate this is what we're going to achieve at the end of 1 year or 6 months or 2 years. What would be your thoughts? What should be the efforts taken by the efforts to be taken by the collaborative, or even for that matter, any of the organizations for leveraging private sector investments and resources for such long-term programs? Thoughts? It's open for any one of you, or all of you even.
Okay, I'll kickstart it off. I think, Arvind, the private sector, firstly, thank you. You've been such a big, ambassador for private sector and, pushing us to look at those collaborations, and we have made quite a few of them. I think going forward, I would say that we need to identify, for example, on pandemic plastic, right? To replicate it, we need private sector partnership. This is about converting plastic into oil and bricks, right? And this is a social enterprise platform. It's the same with the surveillance system. We need private sector to come and participate. I think we need to be a little bit more clear what are we expecting from the private sector, from the CAC side, and then move that forward. And I had this great conversation with the World Economic Forum team recently, who was asking us, how do we collaborate in India? What would you like our support? And I told them that I'm going to share with you a note from CAC and all its partners. What are our various initiatives? Where can private sector play a role and actually gain from it also? There is nothing wrong. Private sector making profit is not the problem. It's about creating larger public good if we can do it together. Why not? Right? And I think that's the approach I would say we should advocate for. And thanks for pushing us in that direction very, very strongly with USAID support and experience. I think we should move a little bit faster in that area is what I would say.
Excellent. Anyone else would like to go ahead, Harry?
I have really little experience in connecting with the private sector, working with them. But what I feel is that Apart from what what they contribute in terms of financially, I think it is their talent that what we need to enhance the professionalism and capacity in our system. And the models they adopt to make their own systems resilient, we can probably learn something from there by actually having them to work with us on a sabbatical mode or something like that. That's one part. The second part is that we have a lot to give to them, because whenever lot of private sector individuals, they told me that in my interaction, that by sending their people to work with initiatives like this, they themselves are enhancing their potential as an organization. So this is how we can contribute to them, by giving them opportunity to work with us on deputation or something like that, and improving them as individuals and professionals. I think these 2 points I would like to say.
Fantastic. Shirish?
Yeah, very quick reaction. And I think building on what Shiv said, that, if moving forward, the 3 interlinkages areas of health, livelihoods, and climate, which could become a priority for it. And I think in each of these areas, I think mapping where the private sector interest lies and leveraging that, because they have experience in each of these aspects. And then also to build on what Hari said earlier, that, about localized humanitarian action, right? And yeah, the point that he was just making of using the private sector expertise to strengthen some of the capacities of community organizations, civil societies, or even the systems and processes, which was done in the past in few cases. But I think this is again an opportunity to revisit some of them and see how we want to basically take it forward. So I think that is a role that they can play. Obviously, financial contribution is one area, but we also know that after 2 years, there is a bit of a fatigue in this system. Just only on COVID-related response, maybe that's the reason why identifying those new areas of intervention for them would make more sense for their engagement beyond this.
Wonderful. I know that we are sort of running short of time. It's almost like 3.5 hours since we started the program. So I just wanted to thank all of you for the insights that you have brought, the support that you have been providing, and the results that you have been able to bring in the field as well as in the system. So thank you, each and every one of you, for your time and your thoughts in this panel discussion. Back to the CMS team.
Thank you so much, Arvind, and also all the panelists who were part of the discussion. It was really insightful and also bounce forward, thought-provoking discussion towards resilience building. As you rightly pointed out, the future lies in strengthening our systems and moving forward together. Congratulations to all the partners recognized for your work in the video. Special thanks to Sangeetha for staying back through the course of this event. We would now like to introduce a dear member of Governing Council who supported us from the start and continues to support with us with this timely council. JVR Prasad Rao sir has remarkable credential in the public healthcare domain and has occupied very senior offices both at the UN level as well as at the national level. He has served as a member secretary of 2 independent commissions on AIDS, Asia and also Pacific, and is currently a commissioner of the Global Commission on Health and the Law.
He is an IAS officer from 1967 batch, West Bengal cadre. Prasada sir, request you to say a few words on this occasion.
Thank you, Shankar. Thank you, all the members, Shiv, Angela, and all the distinguished colleagues from CSE. I really missed much of the action today. It has been such a bad coincidence that around the same time I have to chair an important meeting, which is a bearing on a future and important organization. So I couldn't say no. I had to go there, and but I told Shiv that towards the end, definitely I will come and share my excitement with all of you. I think for completing 2 years of wonderful work on the field at a time when I think people needed us the most. And these 2 years has been a memorable experience for me. I am associated with Swasti, but getting into this extended partnership of so many organizations, and also to serve on the governing council, which meted very regularly to review the work that has been done, and also to suggest how we can do better. It has been a great enriching experience for me, because I was also involved with the COVID response in different capacities, but this is the one which I think gave me the maximum satisfaction. I used to really look forward to those interactive sessions that we used to have. 2 years have passed very quickly, but a lot of lessons have been learned in the process. And a time has come, I think, where we have to reevaluate our own alliance and partnership, and what we should do in future. As we are getting into new problems with COVID, there are other issues also staring on us. And so we have to redefine. I think that is what I was hearing towards the end when I joined. Those 3 areas that were identified, I think, are absolutely the right ones. But I think the role that this organization, this alliance, this collaborative is known for, or has been known for all along, is our rapid response to situations. Quick response. Whenever there is a problem, you have to jump into that very quickly. I think that's what ultimately established our credibility with the civil society and with the communities most affected by this pandemic. So whether it is in environment or in livelihoods or in COVID or in other health issues, I think our main effort should be for mounting a rapid response. What need to be done immediately? Immediate relief, immediate rehabilitation. I think those are the things that are important. And in COVID, I think if you look at the residual work, the vaccination is still going on. I think that's an area where we need to still look at, get involved, because the children are yet to be vaccinated. Some of the young people are yet to be vaccinated, and others have to get their boosters. So continuing work is there, but more importantly, the social support, I think, is very important, where I think there has been a lot of gap in the response, in the national response, because of which people felt impoverished. Many of them have been driven below the poverty line. We have been able to do some work, but I think that is an area where probably we may have to think a little more proactively as to what we can do more in the area of social support to affected populations who have lost their livelihoods, especially the ones with whom we regularly deal with. Of course, the issue of environment is there. Even there, instead of just keeping it as a long-term agenda, we need to look at some immediate challenges, what we can address as a collaborative. I think that's a suggestion I have. But otherwise, I think this partnership is great. We should keep it. And it is so unique because it is not guided by any, it is not regulated by any regulatory mechanism. It is just a voluntary association of so many organizations. I think that itself is a very successful model, which I think others can replicate. But the collaborative, I think, has really done yeoman service to the COVID affected populations in the last 2 years. And I congratulate each one of you who has been associated with this. And let us be in touch, let us stay in touch, let us continue the good work. And especially to Shiv, Angela, to Siddhi, and all of you for keeping me involved in this work. I know I have not been very regular in some of the important events that you have organized, including this one, but definitely I will stay tuned. Thanks a lot once again for giving this opportunity to listen. Thank you.
Thank you. Thank you so much, Prasada sir, for your inspiring remarks and continued support. It's always so humble to hear such encouraging words from you. We have heard from many leaders of government, private sector, civil society, and communities today. But there's so many more leaders and champions here whose voices have not come to the fore. And we want to ensure that we create a platform for every single one of you. As you've seen, a theme that has been an undercurrent of every conversation is having a long-term view on system strengthening and community resilience. And this is why we dream of sustaining the bridges of trust and collective action that we have created over the last couple of years. We dream of systems that nurture humanity at their center to empower the Sumans, Jets, Charitras, and Ujwalas of this world. We dream of restoring a sense of power and hope in the hands of communities. To achieve these dreams, we cannot stop what we started. We need to keep amplifying and deepening our efforts. I think we can all agree that what we started could change the paradigm in which not only we work together, but also the way in which we think, relate, and interact with each other, blurring institutional boundaries and harnessing the power of the collective for greater good. So today, we wish to hear from every single one of you. What is your message of hope for the future? And who would you like to dedicate it to? You could dedicate it to someone that you've lost, someone that you feel is holding the baton for the future. Please use the link that my colleague Amrita is going to put on the chat to leave your message and dedication. And on behalf of the COVID Action Collab and its partners, I would like to say that for every message that we receive from you, every message of hope that we receive from you, we will plant one tree in the name of the person you're dedicating it to. So please use the link on the chat once again to let us know what your message of hope for the future is. And we will take around 2 minutes to see those responses that are coming in. I hope the participants here are able to access the poll. In just a moment, we will see some of the responses that are coming in. Thank you for all of the messages of hope that we are seeing here on our screen. There's a few, and there's around 50 something responses. We may not be able to read through all of them today, but we will be sure to have our partners plant a tree for each message of hope that we have received. A couple, in the interest of time, we will move on to the next segment. Over to you, Shankar.
Thank you, Meghana. It's my privilege to invite my colleague and the Chief Operating Officer of COVID Action Collab, Kunal, to give a vote of thanks. Kunal, who joined CAC as volunteer, and he has been instrumental in orchestrating the collaboration. Kunal, over to you.
Thank you, Shankar. What a splendid journey of CAC from the Janta curfew in March 2020 to now, the end of third wave. A big, big thank you to all the panelists for such an insightful discussion that we heard today, and all the 350 plus participants for joining us today and participating here. As we celebrate this milestone, we would like to express our heartfelt gratitude to all that made it possible. The responsibility, I cannot do it alone. So could I request all the CAC members and panelists here to switch on their videos. Thank you. Firstly, thank you to our CAC partners, their families, their teams, community mobilizers, and all other field staff who have worked tirelessly, whose feedback helped us to shape the various interventions. Their passion to serve the community, even when the resources were limited, is so encouraging. Now, on behalf of CAC Secretariat, as well as all the CAC partners, I would like to thank a few of the other organizations that have provided us tremendous support for making this happen. Thank you to all the volunteers, resource providers, and donors for their timely support to our partners. A special mention to our governing council members who have provided strategic directions month after month, without which we couldn't have managed the uncertainty of this pandemic. Thank you to the investment committee members for guiding us on the resource allocation to our partners and ensuring maximum social impact. Thank you to USAID and Skoll Foundations for the timely investments in CAC, to MacArthur Foundation for financing institutional resilience of Indigenous people organizations, and to Rockefeller Foundation for Call for Swast Telecare initiative. Thank you to Crypto Relief, British Asia Trust, UBS, Vitol, Give India, Ag Grants, Satwa, and other CSR foundations and donors for not showing any pandemic fatigue by continuing to finance our partner programs in Wax Now, high impact interventions, and other district level initiatives. This event wouldn't be complete without thanking the entire team of USAID India Health Office for their strategic support and collaboration acceleration efforts through their Learning for Impact platform, and with the USAID implementing partners, with the government, and with the private sector. Ms. Sangeetha Patel for encouraging us to dream bigger and joining us on the field and partner visits. Mr. Amit Shah for playing the catalyst role of the CAC strategic framework, and Mr. Arvind Kumar for almost daily engagement with our teams, constantly nudging us to raise the bar. Thank you, Arvind, for being flexible during the pivots in each wave and our changing priorities. And finally, thank you to all my team members of the CAC Secretariat and the Catalyst Group who continue to work on a mission mode in spite of the VUCA environment that we operate in, imbibing the resilience quality. And thank you to their families who tolerated the chaos at home during the lockdowns and repeated waves of action. And finally, once more, thanks to this pandemic that gave us this opportunity to become stronger together, to make the invisible visible, to make us aware of the interconnectedness and the inequities that exist among the vulnerable. And finally, showing how the power of collaboration is essential to tide any crisis. While we strongly believe in a mantra, 1 + 1 = 11, Each one of your voices is very vital to shape the CAC's agenda for this year and beyond. Let's continue the dialogue by actively participating in the coming series of partner roundtables and working groups, and on the CAC's social media platforms. In addition to the engagement with your Partner Results Accelerator, we have launched the Partner Helpline on WhatsApp yesterday. Contribute the tools, IEC materials, and other resources to the knowledge repository on the CAC website that is open to all. Finally, continue all your support to the COVID Action Collab as we move forward together towards realizing a common dream to build the resilience of our community. Thank you.
What does it take to turn vulnerability into resilience? It takes a pioneering partnership. Collaborating with over 350 nations. The COVID Action Collab plus USAID India partnership has reached over 10 million vulnerable individuals with comprehensive COVID-19 related health, livelihood and social protection packages. Reaching across 32 states and 309 districts. This partnership has been supporting local governments through technical assistance and promoting local supply chains to manage COVID-19 responses. Working hand in hand with 23 governments and 19 associations. The COVID Action Collab plus USAID partnership has been innovating to create public-private sector solutions and promoting best practices with over 299 learning documents disseminated for greater impact in the battle against COVID-19. We will continue to partner to build a resilient community that doesn't just bounce back, but bounces forward.
Thank you, everybody.